folks in. Got it. Hey, it is 1 o'clock. I'll call the meeting to order. Let the record show that all three commissioners are present. We will start first with our pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. You see, we have folks in chambers. I will inform folks in chambers that we do have a mandatory mask mandate that is in effect in the chambers right now. I do see one gentleman. So I guess I'm asking you, sir,
That's me.
are you going to comply or not? You do have the option of, we did put a box out for you to put your comments in.
I saw all that, yeah. And do you have authority to have me put on a mask in this chamber? Legal authority.
I believe so, sir.
You do?
Yes.
How would I verify that?
I believe at this point it is the chair's discretion at this point.
Well, I'm gonna ask to approach the throne and leave off some stuff with you.
You could do that.
Okay.
This is, although I won't say it's a throne.
Well,
Actually, before I do anything, go ahead. As far as if you want to leave something and then leave, that would be great.
I have a simple question that I sent out by email on Friday, and that is if you as a body or individuals as elected officials support.
Again, sir, I'm not taking public comment yet. You go ahead and get a good angle if you wish there for that. That's fine.
Yeah. Turn it on me. I'm asking them if they will go on record either in support or non-support of Black Lives Matter, which seems to be in place on.
Sir, please, you may leave your comments and depart, or if you're not going to comply.
Yeah, sure. So.
And then I don't want to do this, sir.
Okay, well,
Because if we can't have compliance, then this meeting is not legitimate, and so we would be forced, or at least I would attempt to enforce that, and we would have to go to virtual only. I have folks in chambers that I'm sure would like to be able to provide their comments in person.
all right.
And so I'm just asking you if that would be okay, sir.
Well, that's not okay.
I know it's not okay.
So you will or you won't answer about your support of Black Lives Matter.
I'm not going to answer at this time.
So,
My seatmates can do whatever they wish to do. I don't care.
As far as I'm concerned, the meeting hasn't started yet.
Right. So we haven't. Okay.
pretty good invitation. Is the sheriff coming today?
I have no idea, sir. He is certainly eligible as a citizen. I'm going to stop you now. We are going to continue. Thank you. Thank you, sir.
Here's one for you. Oh,
Okay.
Thank you.
Okay. So with that, I would look for approval of the business agenda.
I guess I can throw that out. I was gonna ask if did everybody look over the minutes, by the way?
I did actually.
Mr. Chairman, make a motion, we approve the business agenda with one add-on under new business.
I will second the motion.
Okay, I have a motion to second on the business agenda. Any discussion on that? Hearing none, all those in favor say aye.
Aye.
Aye, motion passed.
Mr. Chairman, I would make a motion to approve the commissioner meeting minutes from September 7th, 2021.
I would second the motion.
Okay, I have a motion to second on the September 7th meeting minutes. Any discussion on those? Hearing none, all those in favor say aye.
Aye.
Aye, motion passes. That brings us to citizen comment. This is an opportunity for citizens to provide comment to the Board of Commissioners. Please limit your comments to no more than 3 minutes. We have folks in chambers and on Zoom, quite a few people on Zoom. So we will alternate as is our how we've been doing it. And I will start in chambers first. I will ask if there's anyone in chambers that wishes to provide public comment or citizen input comment at this time. Seeing or hearing none. Yes.
I was waiting for other people. Are you recording the meeting now?
Yes.
And it is official meeting?
Yes.
All right. I'm so sorry.
Okay, please give us your name for the record.
Is he timing or you want me to time?
You can be the timer, go ahead.
Let me know when to start.
Anytime you want. man. Get extra time until I get ready.
Yes.
Okay, so I didn't have it all put together, but I've watched for a couple weeks Klickitat County citizens come in front of you and ask you, three gentlemen, our Board of County Commissioners, to sign 2 resolutions, which I am here today. I haven't been much of a part of this, but I've been watching our citizens propose these resolutions to you, which come from Klickitat County, where their county commissioners were brave enough to sign into these resolutions to protect the citizens of Klickitat County. And I've heard that there's over 2,000, I wish, 200 signatures supporting our commissioners to sign these resolutions. One is that the county commissioners support citizens' right to oppose coerced vaccination in Klickitat County, entitles which receive government funding through the county may face elimination of the funding as they are coerced by any means customers or staff into vaccination. The other one is, I wish I had time to read them onto the record for all the citizens of our county to hear. The other one is Klickitat County Board of Commissioners will not require vaccination of BoCC Klickitat County employees. You've had people come in front of you and say people are losing their job here, and we need our healthcare workers. And then you 3 gentlemen can alleviate by signing these resolutions that protect our citizens. You can alleviate the fears of our employees, your employees, our hospital staff that we obviously need. We don't want to lose them. That would cause chaos as we try to recover in our county. So because I've listened to our citizens ask for these to be signed, again, I wish I had time. If anybody behind me would like to use their 3 minutes to read these onto the record, I would love this. You've all 3 taken an oath to protect us citizens, to uphold the U.S. and the state constitution. And I don't believe by you ignoring your citizens to sign our protection here, as other counties have done to protect us. It's time for you to be brave in this time where people are asking people to do things to their body or they will lose their jobs. This is a time for you. You haven't, I don't believe, heard us as citizens when we've talked for requests for solar. You haven't listened to us. You haven't listened to us about the Under Canvas project. And it's funny, let's put this on record. Under Canvas is now suing our county. And I hope that your PA represents that hearing examiner's decision just as harshly as you will represent, your PA will represent against the citizens. That is his job. And Under Canvas is now suing you guys, our county as well, taking our taxpayer money. But back to this. Represent our people who have asked you to protect us against overreaching government.
Thank you. I will now go to folks on Zoom.
I have Gabrielle first.
Okay. Gabrielle Gilbert, go ahead.
Hi, I'm Gabrielle Gilbert. I'm in outside of White Salmon. I'm not Cowlitz County. I'm not interested in having tax dollars rerouted or grant money lost because you're not funding organizations in the county that assist people.
Just a moment, Gabrielle. Can you turn that volume up a little bit?
Oh, sorry. Do I want to make my volume up? Can you hear me?
There you go.
Much better. Good.
Okay. Sorry about that. Again, let me start my 3 minutes now. I am not Cowlitz County. I am not looking for us to lose funding to organizations that assist people in our county, in our community, at the worst possible place in their lives. I am not interested in the loss of revenue to these organizations, WAGAP, the health department, in this time of pandemic and in this time that there is so much upheaval that is manufactured. The organization of this Goldendale Freedom Fighters that came and disrupted your meeting, that you held an illegal meeting to pacify them, is unacceptable. the fact that this organization was nowhere in your sphere at the time when Goldendale literally ran out a Black preacher woman who lived in your community, literally racism, part of Goldendale's fabric, ran out a family that was a Black preacher woman in your community. For this group to come in and spew venom concerning Black Lives Matter is vile. The very fact that the state legislatures, that we elect that representation that goes to the state to craft law, comes down with reforms concerning police, I welcome that. You buried a child in 2016 because you ran that child's car through this county and landed that child in a river where he died. We went to that funeral. I am happy for the laws that come down to avoid that kind of community tragedy. The idea that you guys literally have 1 foot in and 1 foot out as you pacify that kind of behavior that happened on September 14th is unacceptable. I am not going to allow people to be threatened, people to be denied their right for their pursuit of happiness because somebody has a problem with putting on a mask. What you do about your vaccination, that you will determine. But clearly stay away from the people who are not going to fall in line with your Civil War commentary. If anything, they should be investigated by the FBI. You do not come into a meeting and start clamoring that kind of garbage. And we are pushing back on that. We support WAGAP. We support the health department. Black lives do matter. I have an African-American son, my blood, and I will not have people who are in elected positions piss on that, piss on him and his right to freedom and his pursuit of happiness. Stop pissing about with the Constitution in a way that works into a narrative that is completely unconstitutional. It is not okay. And I am sick and tired of you allowing this foot in the door and this
Ms. Gilbert,
snowball effect to
Gilbert.
happen. So do something, really do something.
All right.
Thank you for your time.
Thank you for your comments. We are back in the chambers. If there is someone that wishes to provide public comment. Okay, sir. Come forward.
Short question.
Can you come forward, sir, so that folks on the.
And Ron Kinsella, President Goldendale.
Thank you.
I only got a question. I just heard that lady talk about Black Lives Matter.
Yeah.
Has the county taken any firm position one way or the other on Black Lives Matter?
Not to my knowledge.
You're not going to, you're the director. You're not going to say, I agree or disagree, or what are you going to take a position on?
Why is it necessary for a, I mean, is it necessary for the board to take a position on any question that is put before it?
Do you think it's important to the society in general, the people that are for it, the people that are against it? You know, I mean, we're part of the people.
Sure.
You're a part of the people. I have to, if I decide I have to tell anybody what I want to do, you should have to tell them what you want to do, especially when you're leader of the community. You know, there's questions asked of you all the time, and you don't give an answer. Just give an answer. Everybody's not going to love you or hate you, but you got to give an answer. You just can't keep saying or turn deaf and dumb.
No, I'm neither deaf nor dumb. But I am only, at least for myself, I'm only going to answer questions that are relevant to my job as a county commissioner. I have all kinds of opinions, just like everybody else does. Those aren't relevant to my job. If there is a connection, if it becomes relevant as far as Black Lives Matters or anything else, if there was a protest planned in this county and it was going to impact things, I may have an opinion on that as far as how it was treated. At this point, that is you are fishing for something and you want my personal opinion. I am not going to give you
answer your question, yes or no. That's key. Lots of times you don't even answer a question. You know, is there something in when you sign in that says I don't have to answer questions to the public that elected me? Is there something in there that says that? I don't come to all these meetings. I hear lots of things.
Mhm.
And I've listened to lots of things. But you know, that there's yes and no. You gotta, sometimes you have to step up and say that somebody may not like it, but you're gonna have to say it. So, you know, Black Lives Matters to lots of different people in different ways. In this country, right now, it's got a big importance to lots of people. They affect you, they affect me, they affect everybody in one way or another. So, you know, that's only one question that you haven't answered. You know, don't answer other questions either, so. And
So,
it's the same
sir,
old thing, yes.
would you agree that Black Lives Matter and that discussion is a universal discussion that's being had all over the country? It's a federal issue, it's a state's issue.
Would I agree with that?
And we have no control, we have no impact over where that goes. You just heard the person previous to you have a different opinion on Black Lives Matter than you.
At least she give hers. She give hers.
Our job is to represent not just who voted for us, it's to represent all the constituents. When you have an issue where you feel one way, she feels another way, and we have no nexus to it to begin with, that's why you don't hear us answer about it, because I have a personal opinion, but my personal opinion means nothing in this position.
That's right. Lots of times it means nothing to you, obviously, because you don't answer the questions. This is another question you didn't answer. That's my whole thing is, if a citizen asks you a question about specific things, answer it if you can, or say, I don't agree with that, or I'm doing this, or I'm doing that. But they have to have an answer. That's my whole point. I hear it all the time. You shut the doors, turn them off. They had to close down the meeting. That's not right. So I've had my 2 minutes plus. I'll listen.
Thank
I
you,
did,
sir.
for the record, I did pause your time while he was talking, so he didn't take any of your time.
Okay.
Thank you.
I'm going to go back to Zoom. If there's someone that wishes to comment, this is your opportunity. Raise your hand. Excuse me.
Gigi was the next one.
Okay, Gigi, your hand is raised. Go ahead.
Hi, thank you for giving me this opportunity. I want to read into the record the letter that I sent to all of the commissioners because I'm hearing a lot of opinions in the other direction. So I heard with great dismay the letter from Commissioner Christopher and signed by all 3 county commissioners. I want to say emphatically that this does not represent me or my views or many of the people that I know. As a nurse practitioner, I've always focused on prevention as the primary way to health. Vaccines are the first line of prevention. We have vaccines against diseases we barely see anymore, such as measles, rubella, mumps, chickenpox, just to list a few that are mandated to attend school and to work in healthcare. In addition, hepatitis B is mandated for working in healthcare as well, even though that's not even an airborne disease. But all of these diseases, including COVID-19, kill people. How many deaths have we had in Klickitat County? What are our numbers now? You don't hear about people dying from them because we mandate vaccines on these other diseases. What you view as your freedom could be my death knell. What gives you the right to go about without a mask and unvaccinated, putting so many others at risk? Sure, we've heard about breakthrough infections, but very, very rarely do we hear of a breakthrough death. Vaccines protect lives. How can we get it through people's heads that in order to protect others, as well as yourself, you must practice public health? We require people who work in food service to wash their hands twice and inspect food places for unclean situations. We require people to wear seat belts to save lives. We require people not drink and drive or they lose their license. Why? Because these practices save lives. What about the cost of healthcare for those that don't follow public health practices? What is the cost of one COVID admission on a ventilator? Or the cost when someone is in a car accident but doesn't die and is injured because of not wearing a seatbelt? And what is the cost when people get sick from a restaurant that wasn't following public health guidelines? And who bears the cost? The public. Health insurance rates go up, people end up on disability, and the public pays. Who paid for Sheriff Songer's 5-day hospitalization? You and I pay his salary and insurance through our taxes. And how many others in the sheriff's department got ill and missed work? because they refuse to follow the mandates. It is time to stop playing with our health. You must mandate and follow the mandates. Get vaccinated, wear a mask. Follow Governor Inslee's mandates and stop making such a fuss about your liberty.
You're out of time.
What about mine?
Okay, thank you. Your time has elapsed.
Thank you.
Thank you. We will go back into the room for public comment if there's anybody. Not seeing anybody. Okay, back on Zoom. Sandy Montag, go ahead, please.
Okay, hi. Thank you for taking my comments this afternoon. In my allotted 3 minutes, it's impossible to unpack the 2-hour illegal open public meeting held last Thursday, so I'm not even going to try. I'm really going to concentrate my comments this afternoon on the letter written to Governor Inslee and signed and signed by all 3 commissioners. As voting members, the 3 of you of the Klickitat County Board of Health, your letter was very troubling, filled with inaccuracies and prejudice. The Delta variant has changed the game with its increased communicability, morbidity, mortality, and vaccination is the most effective tool we have to stop this surge. Vaccinating our healthcare workers to protect them and us is vital. Thousands of healthcare workers have been infected with this virus. 3,600 have died as of April. I don't have any figures after that time, but that's the one figure I did find, according to the Kaiser Health News, and I'm sure that number has grown. I wonder how many patients have been infected by unvaccinated healthcare personnel. Thousands of nurses have left their jobs, not necessarily because they've been forced to be vaccinated, but because they are exhausted, angry about the continuing surge of very ill COVID patients when there is a means of protection and a means of prevention. You talk about freedom of personal choice for making personal health decisions. But I ask you, what about the community's right not to be infected with the deadly virus when they seek medical care or go to the grocery store or enter a restaurant? Of course, you realize or should know as a Board of Health that no vaccination is 100%. The COVID vaccine is extremely effective and a fully vaccinated population will stop this virus in its tracks. We continue to be in a state of emergency because our vaccination rate is low, with COVID cases accelerating. As far as I can tell by the data on the Washington Department of Health website, in Klickitat County, we have vaccinated a little bit under 45% of our population as compared to 69% statewide. This is what I got yesterday. We'll see what Aaron has to say about that. This puts our county in the bottom 6 counties for vaccination in the state. As you noted, we have been in a state of emergency for 550 days plus now, and have over 447 positive COVID cases and climbing in Klickitat County since August 1st. Our emergency is increased.
Your time has elapsed, ma'am.
Oh,
Okay.
okay.
I would like to add that Klickitat County has one of the lowest death percentages of anywhere in the state, so.
Now I'm going to go back. We are still in citizen comment. I will come back to the room if there's anybody that wishes. Okay. Kelsey?
Hey, you guys
Your
know
record
me.
or your name for the record. I'm sorry.
Susan Kelsey Goldendale. I wanted to express my appreciation over the letter that was written to Governor Inslee. I took it as a sign that that you were responding to some real concerns and questions that the public has brought up, and I have talked to numerous people who feel the same way, that we just want to say thank you for doing something publicly, and that's all I have to say.
Thank you. Okay, we are still in citizen comment. Becky Miles, you are next in line.
know where she is.
Oh, she disappeared.
Oh, hello.
Oh, there we go. Go ahead.
Okay. First, thank you so much for letting us speak today. I would like to say that I totally agree 100% with everything Gigi and Sandy have said. And so I'm going to cut this short, but I do not like the fact that we're getting 3 minutes each when the anti-vaxxers, anti-maskers got 2 straight hours with 2 of you. And so I'm requesting the same for the people who are actually in favor of wearing masks and being vaccinated, that we get equal time by ourselves to spend some time trying to give you our side of why we feel this is extremely important. And so hoping that one of you or all of you can tell me if that's a possibility.
Good question. I did write it down. I do think you're right. I do think that would be fair. I don't know how we would facilitate that, and I will bring that up for discussion later.
Thank you.
And Becky, this is Commissioner Anderson. I responded to multiple people over the course of the last week from the west side, offering to host a town hall for all of the people that wanted to bring the other side. But that would just be me personally, not with my 2 CMAs.
And my worry is I don't know that we could have a town hall that only has one side, because anybody could be capable of attending.
You already did.
Well, they just happen to be the ones in the room, so we couldn't legally exclude people from any meeting or any town hall for any reason.
You
Even
did.
the Democrat.
You
and
did.
Republican. I'm done.
Sorry, but you did. You excluded the people on the video on Zoom.
Ms. Miles, does that conclude your comments?
Yes. Thank you.
All right, thank you. Okay, we are still in citizen comment for 3 more minutes. I'll come back to the room if there's anybody. Yes, ma'am. You can to speak.
Okay. So I'm Debbie Culver, and I want to thank you for your letter. And I want to thank you for making this available for free choice for the people you work for.
Sorry, I will pause your time. Craig, she's allowed to take her mask off to speak according to the governor's order.
Oh,
Yeah. Continue.
Sorry, continue.
No, that's fine. But
That's why
I'm old,
consistency is so important.
so I'm old and forgot what I was gonna tell you.
I will reset your time and it's only fair.
So anyway, everybody knows. So when you guys wrote that letter, I wanted, apparently not everybody got the memo. You can't tell me to get a vaccine. Correct? If I'm correct, right? Because I asked this question 2 weeks ago. You cannot force me to vaccine, or you can't make a vaccine mandate that everybody in the county has to be vaccinated.
Not to my knowledge.
I don't know of a law that gives a.
So you don't have the
I-
authority to tell anybody to get a vaccine or not get a vaccine except your employees, correct?
I don't even know that we have the authority for our employees.
Okay, so I just wanted to, it seems like there's some confusion here that you guys have the power to tell me to get a vaccine and you don't have that authority.
Nobody's told me I have that authority.
So, yeah, that's why I asked a question a couple weeks ago, because I got into a discussion with somebody else who said, yeah, they're going to tell us to have a vaccine. You can't. Right?
Not that I'm
I
aware
don't
of.
know if
Okay.
I'm aware.
Thank you for the letter. I appreciate it.
Thank you.
Happy birthday.
Okay, we are still in citizen comment for 1 more minute. Does somebody want on Zoom?
Pat Arnold's next on the.
Pat Arnold, go ahead. And I'll actually
She's
give
had
you
her
the,
hand up. from
you've had
the
your
start.
hand up, you get all 3 minutes. Go ahead, give her 3 minutes.
Can you hear me?
Yes, go ahead.
Okay. Obviously, you know that I don't think the letter was a sensible thing to do. I think I would prefer that you actually got out front on the whole issue of how we can approach the pandemic. I get unhappy when we get into these dialogues about vaccine or no vaccine, mask or no mask. You know, there are kids in the Trout Lake School who've been in classes with children who have tested positive, and the health department has not seen fit to do contact tracing for children in the same class as a student with a positive test. We not only need the vaccine, we need and masks, we need a better approach overall. And this is where I'd like to see you guys going. You know, we all want this pandemic to end. We want it to end as quickly as possible. None of us like wearing masks. You know, I don't mind the vaccine, but I certainly don't like wearing a mask. But it's silly to spend our time arguing about vaccines and masks when the point is we need to get past the coronavirus and we need to mobilize in a serious way to do that. So I would like to see you write to Governor Inslee and say, gee, we're concerned about our constituents. We want to get past this pandemic. Can you, tell us other things we can do? Genetic testing, better tracking, better statistics, and there's a lot that we can do rather than sit around and argue with each other about masks and vaccines. That's one thing. The other is that, I was really disappointed about what happened on Tuesday. And there's a lot of emails flying around. And somebody said that one of you said that you were doing it to protect employees who were in the room. Stand up, walk them out of the room and protect them that way. I have been before you guys numerous times, as you know, over a very long period of time, and many commissioners who predated you. I've seen generations of commissioners. I am used to having the gavel fall. You're done. I am used to not having any response. I am used to not having any opportunity to actually talk with you guys or try to come to some common agreement. It's always like, here's my case, and you go, nope, that's not a good case. Bang, we're done. If you're willing to try to appease people who have such a bad history or bad understanding of history, somebody said it was like the Nuremberg trials. That's nonsense. This is not anything to do with the Nuremberg trials. And it's like we need to have honest to goodness dialogue and conversation. And for you to sit there and let those people threaten you and let Sheriff Songer threaten you and to try to appease them, it's really, I could hardly believe what I was seeing on those videos. And I'm very sorry. I like you guys. Personally, I don't, and it just hurts me.
Arnold,
it just hurts to see
the gavel's falling. So
Thank you.
that
I would ask, Mr. Chairman, since we don't have any time in our meeting later because we're super busy to have more public comment, there's one more person that's had their hand up for 15, 20 minutes. Can we give them 2 minutes and then be done with comment for the day?
until somebody else raises their hand.
It's, I'm just, Chairman's prerogative, I'm asking.
We have a packed agenda,
It is
partly because things had to be moved from last week. So I'm going to say no.
You do have only one person with a hand up.
Okay. All right.
give it a time limit, 2 minutes.
3 minutes is fine. Go ahead.
Luke,
Luke, are you there?
Good morning, commissioners. Thank you for the time. I
If you
appreciate
need it, call.
that. Can you hear me?
Yes.
Yes. Okay. Thank you very much for the consideration of time. I would like to just address the consensus that I've heard today from Gabrielle and Gigi and Sandy and Becky and Pat, and I'm sure others before I came on today. It would seem that the meeting last week riled up the left side of your constituency, and for understandable reasons. However, I would say that there are many things I've heard that are untrue, would be one way of putting it nicely. The idea that anybody was threatening you or the sheriff was threatening you, I think is just simply inaccurate on its face. I would declare that false, so let that be read into the record. I also see a coordinated assault wherein at least the first three speakers I heard, Gabrielle, Gigi, Sandy, were speaking specifically from talking points that were scripted. This is a tactic that's used by the left to get everybody into lockstep, using the same words, repeating the same phrases. As far as the community's right not to be infected, I just want to pause and hold that in mind for just a second. The community's right not to be affected. That's a very cerebral concept. It's a very head level, pie in the sky idea. The community's right not to be infected. On its face, it is absolutely absurd to state that the community has a right not to be infected. As human beings, getting infected, getting sick, seasonal flu, etc., is a natural part of life. Not only should we not fear it, we should understand that it's a predictable part of life. And yes, there is mitigation that can be taken. There are vaccinations that can be taken. But again, those are personal choices that can be made. So I want to just retract from the head level cerebral debate, as Pat was alluding to. You know, we could bicker and debate about all that, but come back to the heart level for just a moment. And imagine that you or I, imagine yourself or each person in the room or on Zoom right now, imagine you're the one that's out there trying to put a mask, a cloth on somebody else's face. Imagine walking up to a stranger and telling them that they're a threat just for standing there breathing and being a human being. And you're going to convince them, you're going to put a mask on their face against their will. And in this hypothetical thought, what's the reaction going to be? It's going to be an instinctual resistance. Nobody wants their face covered. Nobody wants to have their breathing restricted. You could carry that thought experiment out with vaccinations. Imagine taking yourself, not government mandate, but you as a human being, taking a needle and going to convince somebody that this is for the sake of public health and safety. You have a right to shove that needle in their arm. And they say, wait a minute, no, I don't think so. I don't want that. I'm not sure what's in that, or I have some reason not to get that. Maybe I had a dear family member that had an adverse reaction, fell over dead, or developed, a lifetime of complications due to a vaccine.
Your time has elapsed, sir.
Okay, thank you, gentlemen. I appreciate your time.
I'm going to close public comment and move us along. The time being 1:36, time past we had set for public hearing, public meetings, and bid openings. Our first order of business is a public hearing that was continued to consider a supplemental budget and amendments to the 2021 budget for various funds and departments in the sum of $602,285. And at this said hearing, any interested taxpayer may appear and be heard for or against the proposed supplemental budget appropriation. But let me be clear on that. We will start with a brief staff review from, come on up.
From staff.
From staff.
Hello, commissioners. So we revised the supplemental budget for now to include only the election reserve fund, Fund 111, and then the tourism fund, Fund 123. And the rest of the supplemental requests are under review as to where the funds will come from.
Okay, can you give us the total of those two funds?
Fund 111 is $66,533. Fund 123 is $52,366.
Thank you. I could have looked it up, but it's easier.
No, that's
I saw
fine.
that you had it. Okay, and just for the record, the board has it's within it can't raise anything that was published, but it can approve a supplemental budget that's less in amount than what was advertised. So that's acceptable. I will now open the public hearing to take public comment on this supplemental appropriations. Sir, do you wish to give public testimony?
Yeah, I got a.
Could you please give it, can you come?
Bill Eldred, Goldendale.
Thank you.
I got an email from Commissioner Christopher that said he cut the budget by $1.7 million.
That's not true.
So why do you
I
need
think we have to.
600,000? What'd you do with the 1.7 million
It
that's
said
cut?
we need to. I didn't say
Please,
we
please,
have.
he's giving his comments. Go ahead.
So I just wonder, if you cut 1.7 million, how come you need 602,000?
Okay.
What'd you do with this 1.7 million?
No, I believe, go ahead if you wish to.
There is no 1.7 million yet. We haven't done it.
We
And
need
then,
to.
okay.
That's what the budget process is for right now.
So do you have testimony relevant to this?
No, it just appears like we have an overspending problem here. That's what it looks like.
So are you speaking for or against
Against.
the stuff? Okay, thank you, sir. Okay, we are still in public hearing right now for this appropriation, this supplemental appropriation. Is there anybody, I'm gonna go on the Zoom, is there anybody online that wishes to provide public comment on this specific budget supplemental appropriation? Please raise your hand or unmute yourself, *6 if you are on a phone. I will ask my seatmates to check. There's a lot of,
Oh, sorry,
there's a lot of, I have a lot of screens.
No, there's not.
Okay, is there anybody in the room that wishes to provide public comment on this topic? Seeing none, I will now close the public hearing for public comment, discussion by the board, or questions.
I do have a question.
Yes.
The election reserves fund, 111, that $66,000 is COVID grant money reimbursement, right?
Yes, so that was CARES funding that
CARES
was given, that was provided for the auditor's office. They did not use all of it, so they have to return the unused portion.
So we are returning
Yes, we
66,000,
are.
and that's the one thing we're doing here.
Mhm.
The other one is the tourism, out of the tourism funds to provide the pass through to the two chambers. Okay,
Any other board questions? No questions here.
no question.
Okay. With that,
I would make a motion that we approve the supplemental budget for 2021 of the, since my cheat sheet's wrong, of the election reserve fund for $66,533, and for Fund 123 tourism for $52,366.
I will second the motion.
okay, I have a motion and a second to approve that portion of the supplemental budget request for the election reserve fund and the tourism fund. Any further discussion or any discussion? There being none, all those in favor say aye.
Aye.
Aye, motion passes. The budget is, budget appropriation or supplemental is approved on those two. We'll be back on the other stuff. Okay, thank you. Next, we have a public meeting to consider approval of short plat SPL 2021-13. This is in the Centerville vicinity. Applicants are Daniel and Nadine Rhodes, and I believe we have staff will provide a brief update. Denise?
Yes,
are you on? There we go.
This is Denise Lee in the planning department. You guys hear me?
Yes,
Okay.
go ahead.
All right, so what we have is a short plat, SPL 2021-13. It's a proposal to create 4 lots from parcel 03151000000100. The proposed short plat is located in the Centerville vicinity off of Finn Ridge County Road. The administrative review of the short plat has been completed. Signatures have been obtained from the road, health, and planning departments, including the treasurer's office. All conditions attached to preliminary approval have been met. If the board finds it's in the public's interest to approve the short plat, a motion needs to be made granting final approval of SPL 2021-13. Applicants Daniel and Nadine Rhodes. You should have a 2-page Mylar
Yes, we do.
somewhere.
Yes, go ahead. Does that conclude your?
That concludes my
Okay,
deal.
this is a public meeting. Any questions? Anything for staff? Pretty cut and dry. Okay,
No
seems
question.
pretty cut and dry to me too. I would entertain a motion.
Mr. Chairman, I make a motion that we approve short plat SPL 2021-13, parcel number 03-150-1000-001/00 in the Centerville vicinity. Applicants Daniel and Nadine Rhodes.
Second the motion.
Okay, I have a motion, a second, approving short plat SPL 2021-13. Any discussion? Hearing none, all those in favor say aye.
Aye.
Aye, motion passes.
Thank you.
Okay, our next order of business is a department update. This is Public Health Director Aaron Quinn. I will remind folks, this is not the Board of Health meeting that is scheduled to take place at 2 o'clock. So this is the Health Department's update to the Board of Commissioners. Good afternoon, Ms. Quinn.
Brought, because I know things are more fun in color.
Thank you.
So I'm gonna just leave all of the COVID updates for the Board of Health, but just talk generally about kind of where we're at as a department.
So there is, your office does other work besides COVID?
We do, and I get really excited to talk about it because some days I think it's important to remember that there is life outside of COVID. So we've continued to offer our WIC services remotely. So this update is covering the months June, July, August. We've served 252 WIC clients. The WIC is a federal program, and so they do believe that it's going to continue to be remote at least through probably the end of the year. So it's actually been pretty successful that way. Obviously, we're all excited to, eventually bring them back into the office when it's appropriate and safe for little ones to be out and about. So that's been going well. We've reinvigorated our breastfeeding peer counselor program, and we have a coordinator, Anna Coughlin, has put the program back together. We had that program for some time. We actually got a federal award in 2015, I believe, for the work that we've done supporting breastfeeding moms in this county. So we're excited to kind of get the ball rolling back on that again. So we are looking to add the 2 peer counselors to the program. They're contractors, they're WIC funded. So the staff have been looking for a good fit. One of them does have to be bilingual. That is a requirement of the program. So I've reached out to some individuals in the county who would be a good fit and meet the criteria for that as a current or previous breastfeeding mom. So immunizations, we actually do immunizations other than COVID vaccine. So we're fairly busy this fall getting kids up to date for school. So they did a lot of back to school immunizations. In white salmon, it was noted there was a pretty big need for Tdap. There was a lot of kids behind, so they're going to run a Tdap clinic on the 29th.
Yeah, I was gonna. I didn't
Tetanus,
want to.
diphtheria, and pertussis.
You didn't want to seem silly. You
Yeah.
left that
No,
for me.
no, that's fine. No.
It's working through it. Just leave it till the
You guys
end.
are busy throwing each other under the bus. Tetanus, diphtheria, and pertussis.
Okay.
So they're tetanus boosters, so they get better around age 11. And so there was quite a few that were non-compliant, so they carved out a Wednesday afternoon to help address that and get all of those students up to date within the school system. So we had a really good working relationship with the school nurse, so we're really excited about being able to help them out in that manner, and the families obviously too. Our family planning program is still continuing to build. They saw 42 clients over that time frame. We only see clients 1 day a week, so that's, we're not doing patient care 5 days a week for family planning specifically. So our nurse practitioner is out on maternity leave until January. She had a beautiful baby boy on Saturday, so we're all very excited for her. We're having the nurse practitioner that was previously employed at Skamania County as the family planning nurse practitioner will be covering her maternity leave. So already familiar with the state rules and the programming, because it's the same across all counties. So we were very fortunate. She will be joining us October 1st and covering until the 1st of January when Lisa comes back. We also received the perinatal mental health grant that is going to help provide mental health support for women who have given birth. It is to be led by peers and community members. So there's some folks that have volunteered to help lead these support groups for these women. So it'll probably be tied in kind of with as a similar programming to the breastfeeding program.
there was a lot of energy and excitement around that. And so really excited to be able to offer in a very small way some mental health support to these women in our community. We do have a new front office person joining us October 1st in the Goldendale office. She'll be filling the position that has been empty, I think, since towards the end of July. We're really excited. Mackenzie Coleman, she's joining us. She was at KVH and has a really good energy, and we're really excited to have her join us up there. So that's fun. So new things for us. Environmental health. I did put the graph in the back about the OSS site evaluations. It doesn't really break down, I don't think, east and west in the actual graph, but David did call out the numbers. So you can kind of see the growth on the east end and the west end. He said that had been a request earlier, so he wanted to make sure that he called out. For permits processed, we've almost doubled what we did last year. Site evaluations, another significant compared to last year as well. So they've been pretty busy. I know the turnaround time has been about 3 weeks to a month on getting the permits processed just because of the sheer number of those. They continue to do the water samples. They've been doing really well with that. They got the new with our foundational public health monies, they were able to get the new incubators, and that's really helped increase their ability to do quantities. So that's been really helpful. I know that they have 8-ish compliance cases open that they're working. I know one of them, I think they've met with the new compliance officer, and they were excited to move forward with working with that. We did just get signed off the MOU with the Department of Ecology that will allow for
Actually, I'm
people.
gonna stop you, just my brain is a little behind.
That's okay.
8, did I hear that right?
Septic.
8, and then those are,
Active.
just so we know that it's all septic, there's no water.
Not that those
Okay.
I believe are the septic ones.
Okay.
So the MOU that we just signed with the Department of Ecology allows, sometimes it's a barrier for people to get these cases resolved due to cost, because obviously it's expensive to potentially do that. So with this MOU, we do have the ability to link people with services that will help them. So it's low interest. If you maybe have bad credit, they can still help you get the loans to repair what needs to be repaired to get you in compliance. So hopefully that will help. I know some of the compliance cases in the past have been challenging due to sheer cost and people not having that.
I'm wondering if the newest, because I did have a press release or a notice yesterday that we, meaning, the county, as far as our partners, were successful in another round of the home repair program that we ran before. And I'm wondering, because the idea of that is it's no interest. In fact, you don't have to repay it until you leave the house, whether it's it's really geared towards if you have like life safety issues, particularly for seniors, that you can go in. So the idea is that you can make the repairs so you can stay in your home. And then when you're no longer in your home, or you've moved in with your kids or moved on, then it all gets settled out at that point. And I'm wondering if the septic systems, I'm just brainstorming, I think that would be an eligible use of the dollars, if to me, that's as relevant as.
We're checking.
Yeah, and so I don't know on this one.
Because there was a $400,000 appropriation that we had. That's Klickitat and Skamania. City of White Salmon is the manager, but the funds can be used anywhere in Skamania and Klickitat County. City of Bingen did it the previous time or the first time, which we owed a favor for, that I paid.
How that works.
Yes. It was a totally appropriate.
I expected more.
Yes. We got
I
through audit.
You probably had to sit through a few meetings.
Yes, that I did want to. Yeah. So anyway, that will be a good thing. And that would also be something with.
I'll talk to Marla about that.
Yeah.
Because I honestly, and I can't speak to right now whether or not this program that we just got with the Department of Ecology, and all we have to do is sign the MOU that says in this county, this is available to you. And then we can help people get like, this is who you need to call, but we don't actually have any part of administering the monies or anything like that.
Okay.
And I don't know if that's part of the program where you have a
I think this
deferred
is a
payment.
different, yeah.
Or so that the living environment one sounds like potentially that might be something we would refer people to first. If for whatever reason that didn't work, then we'd have the backup, but certainly trying to make sure that, we can help people in instances where they potentially may not have the ability to comply because of financial reasons, because certainly in this county, that is a concern on some issues, so. As far as food safety goes, Kelly Sizemore is moving on. She's been with us for 7 years. We're very grateful for everything she's done with us. She's been a stellar employee and we're gonna miss her very terribly. She got a really good opportunity and we wish her well, but we are also currently hiring for that position. She is the food lead, so it's mostly focused on food safety. And a position obviously we're required to have by the RCW that we do food inspections and licensing restaurants and that sort of thing. So they issued 138 food worker cards in July and August. I thought it was interesting. They did the breakdown in languages, which I hadn't seen them do before. So that's interesting that we have, we did 134 in English, 1 Korean and 3 Spanish. So I don't know, I thought it was interesting. The environmental health team still continues to help us with the COVID response. And again, I'll cover the COVID response once we get to the Board of Health. So they've been really helpful with our vaccine clinics. They've been really supportive of that. And I'm sure they know, but will continue to help us with our vaccine clinics through the fall and really helping with social media updates and keeping the website up to date. They did continue to do surveillance for algae. It says Roland Lake is still blooming. I know at one point there was quite a few. We did post signs and worked with the parks departments when it was appropriate, or whoever was the key partner to make sure that the appropriate signage was posted during those blooms and the appropriate warnings. We did complete our mosquito surveillance trapping. We did that from June to September, just so I think last week was or 2 weeks ago was the last week that we did it. So every week throughout the summer, they went to different areas around the county to do mosquito trapping. I know they did a couple of times out in the Alderdale area. I know they've done Trout Lake, Glenwood, some places around Goldendale and White Salmon as well. I haven't seen the
Testing for West Nile or something?
Yeah, and I haven't seen the results of the trapping and testing yet. We will probably, the Department of Health will likely put those together when we get those kind of in the next coming months. So we'll have that information, but we're really excited to be able to participate in those surveillance programs for that. So Skamania County, Nikki continues to do the environmental health Skamania County with our partnership that we have with them, and has continued to be busy with Skamania County's increasing obviously their business as well. And she's been helping us just kind of with some social media stuff. So we're really grateful for that. And then just on the back, I just did just your basic case counts. I think currently, I printed this morning at 7. I think the current case count, I think yours says 1599. It should be 1613 as of this afternoon. They were able to recover some individuals, so we're down to 74 active cases at this point, and 15 deaths. So
74 active.
yes, sir.
15 deaths.
Yeah. Anyway, I will just leave COVID for the next iteration, but pending your questions for any of just our department updates.
Regular department update.
Well, very detailed, thank you.
We're about 1 minute from the Board of Health meeting. I do.
Your board's on there.
They are all on there. Okay, good.
So is Dr. Person.
Dr. Person. Okay, well, actually, I guess first we'll do this. I will recess the Board of Commissioners meeting. And
Do you need a motion?
I think I do. I mean, we
We
never
have,
but I
but I looked at it and I think officially.
we do. I think we learned I don't unilaterally have the power to recess.
I was gonna say, I thought I read that last week.
Somewhere it seems. I don't know where. Yes,
Mr. Chairman, I make a motion that we recess the Board of Commissioners meeting until after the Board of Health.
I will second.
I have a motion, a second to recess the Board of Commissioners meeting. All those in favor say aye.
Aye.
Aye, motion passes. Okay, with that, I will now I will call to order the Klickitat County Board of Health. Welcome, folks that are, and if we can, just for the record, acknowledge that all 5 Board of Health members are in attendance, and Dr. Person, our health officer, and also Director Quinn, who is staff to the Board of Health. That seemed reasonable. I didn't demote you, did I? I don't think so.
That's fine.
All right. So we are in order. I guess I would be looking for a motion to approve the agenda.
So moved.
Okay, I have a motion and a second for the agenda that was provided. Any discussion? Hearing none, all those in favor say aye.
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 Aye. Motion passes unanimously. It brings us to the minutes. Hopefully folks had a chance to review those. It's July 15th. Yeah.
Mr. Chairman, I make a motion, we approve the meeting minutes from July 15th, 2021 as presented.
Second.
Okay, second by Ms. Pennington. I have a motion, a second on the July 15 minutes. Any discussion? Hearing none, all those in favor say aye.
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 Aye. Sue seconded, so that looks like an aye. Motion passes. That brings us to COVID-19 discussion. So we have on here the clinical update is going to be led by Dr. Person. So we will start with that. Dr. Person, welcome.
Thank you. And thank you always for the opportunity to provide some high-level clinical updates. I will leave it to Director Quinn to provide more of the specific actions that Klickitat County Public Health is taking. So I wanted to cover a few topics. One thing about COVID is that there always seem to be things changing and new guidance and recommendations. Talked today about vaccines. First thing I wanted to touch on is breakthrough cases. That's something that gets a lot of interest and needs to be understood that breakthrough cases are to be expected. The primary purpose of vaccines is to prevent severe disease, hospitalizations, and death, and they remain very effective in that. Prior to the emergence of the Delta variant, the vaccines were also incredibly effective at preventing transmission. Since the Delta variant has appeared, we have seen more breakthrough cases. At the state level, there have been a total of 31,708 breakthrough cases. In that same time, there have been a total of 291,378 cases. So breakthrough cases represent approximately 11% of the total cases that have been seen. So we still are seeing a majority of cases in unvaccinated individuals. In Klickitat County, there have been 54 cases total in individuals who have been fully vaccinated. During that same time, we have seen 578 total cases. If we look at the difference before and after July, which is essentially the difference before and after Delta became the predominant variant prior to Delta kind of being on the scene, individuals who are vaccinated only represented 1.6% of cases in Klickitat County. Since July, they now represent 8.7%. So again, with Delta, we do see an increased risk for infection among vaccinated, although they still represent the minority of cases. And part of why we are seeing breakthrough with Delta is that there are two factors going on. One, we know some individuals do not mount a full immune response. Those are the immunocompromised, and that was the reason for the recommendation earlier last month for individuals who were immunocompromised to get a third dose. That wasn't to replace waning immunity, but was to actually get them to a point where they had immunity. One of the advisory committees for the FDA met on Friday to discuss booster doses, which is, again, these are doses for individuals who've been vaccinated to boost waning immunity. The recommendation from that committee was that at this point, not that everyone get a booster dose, but that individuals who are 65 and older and those that were at higher risk either for exposure or higher risk for severe disease should be considered to get a booster. Now, this recommendation is only the first step towards, recommendations towards booster doses actually being given. After the committee from the FDA provides their recommendation, the FDA as a whole will need to review that and make their recommendation. And then the advisory committee on immunization practices at the Centers for Disease Control and Prevention will need to meet and make that recommendation as well. So we are not yet at the point where those booster doses are being given. Although I know after the news came out on Friday, I'm sure there were calls to the health department, but we are still in the process of that being fully evaluated, and those recommendations need to be made from both the FDA and the advisory committee on immunization practices before booster doses will be available. And then the final note I did want to touch on, because we have seen warnings and advisories coming both from the CDC and from Washington Poison Control is on the use of ivermectin. So that has become a popular topic in social media as a potential treatment for COVID-19. There have been no clinical trials that have indicated that it does have value. Unfortunately, because it is available as a treatment for animals, individuals have been able to purchase it. So Washington Poison Control has seen calls to the Poison Center triple related to ivermectin poisonings, and a majority of those calls actually have occurred in the month of August. People really need to not be making that decision on their own, particularly using medications that were designed for animals. The dosing on those does tend to be significantly higher, and there is a very high risk of accidentally poisoning yourself. And again, there have been no clinical studies to date that have indicated it works as a treatment. So we do not recommend the use of it and actively discourage others from that. And that is it for my clinical updates. So I either open it up to questions or turn it over to Director Quinn at the board's discretion.
Okay, thank you, Dr. Person. I am going to ask for questions from board members for Dr. Person on her clinical update. If there are any, I'm not seeing any from board members via Zoom. Okay, so we will continue on then to our.
So I have my hand raised for questions.
No, there will be an opportunity during the citizen public access to the board. Further down, this is the opportunity for the board to ask questions of their health officer. So you will get an opportunity. It's just further down the agenda. So that moves us along into the situation update. If you wish to take that, Director Quinn.
Yes, thank you. So it's been a busy couple of months for us for sure. So we talked about we're up to 1,613 cases. We had more cases in August than we had through March through July combined. That was the highest case counts we've had. We know that there's actually more circulating than the cases that were reported to us due to the availability of over-the-counter tests that people can take at home, and obviously do not feel compelled to call, which we respect, but understand that there is more disease in the community than even that we're aware of. So on, in like official lab format. So it continues to be busy. We're on track. I think we've had 200 cases this month, so we could easily meet the same as August, if not more. We have seen in the last 2 weeks a small downturn, much like they're seeing around the state and the local areas as well. So we're really hopeful that will continue to be the trajectory that we're on. We did add another contact tracer to our team. One of the challenges that we've really been having is that people won't take our phone calls. And we need to make it very clear that we do not ever go to people's homes. So if someone came to your home and said they were a contact tracer, they are not from our office, so you should not answer the door. We do want to touch base with people by phone because we have the ability to get people in touch with services. So if you needed to quarantine and you needed groceries, like we can help arrange a lot of that stuff for you. And then ultimately a lot of employers are asking for letters to return to work. If we haven't been able to reach you on the phone, we are unable to provide that for you so that you can go back to work. So we're just asking people to make sure they answer the phone. It's usually a pretty quick conversation, but just want to make sure that when people do answer the phone, that they are okay. And if they have medical questions, that we can get them answered for them. Much like Dr. Person relayed, we are talking to a lot of people that are using ivermectin, and again, are recommending that people consider not doing that, but do understand there are providers in the area that will prescribe that, but that you should never take those medications without medical providers conversations. So definitely have those conversations and make sure it's appropriate for you, which ivermectin is not, because there is no clinical evidence that supports taking that. So I think the big thing is for us is,
before you move on for that, it does have some clinical uses beyond veterinary use. I mean, in humans. I mean, it is prescribed for things that are on its label.
Person can correct me if I'm wrong. It's an anti-parasite. So when I've been on a few of my other trips, I have had to take that based on exposures. So, but that was from a prescribed doctor. It was an appropriate situation for parasites.
Was it pill or was it?
It's a pill.
Poron? I think what most people are buying is
paste.
Poron that you buy on the back of the
No, we do not recommend
cow.
it, but yes, there is a use for ivermectin. I myself have taken it, not for COVID. I took it for parasites. Can't always control where you end up. So vaccines, we are planning for boosters. We've been planning for boosters. We knew this was coming. If the recommendation continues to be 65 and older, we feel really good about where we're sitting as far as being prepared. I asked Sharon Carter, helped me out with some data the other day. She said there's approximately 4,000 individuals 65 and older in the county based on some census data. We know if you look at the DOH website that there's 57 to 60% of those 65 and older that have already been vaccinated or have initiated their vaccine. We know that quite a few of them, at least on the west side, through just the health department numbers, were vaccinated with Moderna. So probably looking somewhere between like 2,000-ish individuals that will need to get vaccinated. based on, if that continues to be the recommendations, that it is 65 and older. So we have amazing partnerships as we have throughout this entire response with both hospitals and North Shore, and are meeting once a week to talk about how to make sure that we are making these boosters available to county residents as much as possible. So I know our nurses have been going out to the east end of the county. They've been out to Bickleton, Roosevelt, Alderdale, probably about once a month, if not more, to make sure that people have access to the vaccines. We are looking at partnering with the Department of Health. They will send a mobile van down. The idea is for one day in Goldendale and one day in White Salmon to help take just some of the pressure off all of the health systems that are stressed in our county right now to provide boosters, but so there's continuing access. And we should hear about that later this week if that's confirmed or not. So we do have tentative dates selected for vaccination events, be it the fairgrounds in Goldendale and this, I believe the bus barn in White Salmon. Everybody's tracking the dates. We're just waiting for approval from, as Dr. Person said, the FDA, the CDC, and then the Western States Group, which is the Washington, Oregon, California, I think, and Nevada, that also reviews the data before they approve the vaccine. So once we get the go ahead, we have the posters are ready. We can put the dates that are most appropriate for the timeline, and we'll advertise that as so that people can come get their boosters as they wish. We are still continuing to work through the process. We had an opportunity to get FEMA reimbursements. We are processing reimbursements for the vaccine work that KVH did at the fairgrounds last year, for Skyline vaccines last year, and then for the fairgrounds, I think we're like $120,000 we've been able to give back to the fairgrounds for the space that we've used up there. So I've been led to believe that we're one of the only counties that's actually going through this process. We've been fairly successful, so we're really excited that we've been able to get that money back to the community that's been giving the vaccines to us. So that's been a really big win for us. And then I just wanted to, I think the hospitals.
I just want to say, as one of the, in my other role, one of the appropriators that fund activities at the fairgrounds, getting a reimbursement is great.
Yeah, no, I was really excited that was actually really the push for me, was that we could get kind of some of that money back into the community. So a little extra work. It's been kind of a process, but we're getting there. And I think by the end of the year, it will be a decent amount of money that has really helped with this response. So
great.
And then with that, I just wanted, Skyline is unable to join us, I believe, but KVH and North Shore had representatives that were going to kind of give an update about what's going on with their facilities and that. So first, actually, just make sure, Jenna, are you on?
Yeah, I'm here.
Okay. Did you want to give a just kind of an update about this Skyline ER scenario?
Sure. For those people that don't know me, my name's Jenna Newcomb. I'm a physician assistant. I work for both Skyline Health in the emergency department and in the family medicine clinic. I can tell you that I spoke with our infection prevention specialist just before this meeting, and the data that I have is current as of today. We, at this point in time, we don't have anybody hospitalized for COVID. I do know that we do approximately 30 to 40 COVID tests per week for our hospital. In clinic, on average, per provider, we're doing, we have seen a downturn this week as far as number of tests requested, but I know I've personally been doing 4 to 5 tests on most of my work days for me personally, and then my colleagues as well. I do know that from the emergency department standpoint, all of our transfers into the city for COVID-19 have been unvaccinated in the last 3 weeks. We are giving out Regeneron infusions and we're getting requests actually from all over the region for Regeneron, even on the weekends. Approximately 2 to 3 patients per day in the ER are COVID positive, and about 85% or more are unvaccinated for that. I do know that weekly phone calls between our facility, Dr. Person, And the remainder of the people on the committee have been very useful for our organization, and that any questions that we have been answered promptly by our health officer. So we wanted to say thank you for that. We do remain to have challenges with transferring patients into any facility for any reason, not just COVID-19. We do have for heart attack, stroke, trauma, and COVID-19 and any other reasons that we might need to transfer people in. It's a very challenging situation at this point in time.
Jenna, would you just do a quick confirm that Regeneron is the monoclonal antibody, and maybe just can you talk about that for just a second?
Yeah, I can talk about that briefly. Regeneron is the monoclonal antibody infusion that we are using to help people who are COVID-19 positive, whether or not they are vaccinated or unvaccinated. And the point of it is to reduce the risk for progression to severe disease. For those people at high risk, and I would say the majority of Americans are considered in that range, because if you have a BMI of over 25, then you qualify for Regeneron. We do give that to mild to moderately ill people. So if you, for example, when I've seen people in the emergency department and I've tested them and they've tested positive and they are either vaccinated or unvaccinated, then I will ask them about the Regeneron infusion. And when I do telephone and then car side assessments from the clinic, I will ask them about that as well preemptively. And I've ordered several of these. So the point is to reduce people's risk for progressing to severe disease.
Thank you. Cindy, are you on the phone to update from North Shore?
Hi, yes.
Does anybody else have any other questions?
Oh, no other questions. Thank you, Jenna. Cindy?
Hi, yep, this is Cindy. So we continue to see a high level of cases. We also have a high need for testing that we're experiencing. And on most days that, the folks that are calling for testing are more than we have the capacity to do. So we're trying to just work through test as many folks as we can and then refer folks out to other testing locations when it's more than we can do. We have seen a very high positivity rate on those tests, particularly over the last 2 weeks. We've been running in the 20 to 30% positivity rate. The other thing to add is just, as always, a huge thank you to the health department for all the work that they are doing. We really appreciate their taking the lead on the large booster clinics that we're all putting together. So having them take the lead really will help in for residents, instead of having to get onto 4 different wait lists like we did last or at the beginning of the year. This will make it one streamlined way that then will be staffed by the health department, North Shore staff, KBH staff, and Skyline staff, and just doing it all together. So we're looking forward to that. As Erin said, we're preparing what we can ahead of time, but realizing it'll take just a few days to finalize things, after the regulatory agency decision. So we'll appreciate everybody's patience as we get that new project stood up soon after that.
Thank you, Cindy. Leslie, are you on for KBH?
Here at KBH, very similar stories to Skyline and North Shore. So we have testing capacity some days, and other days we do not. We schedule as many as we can, get them through, but some days those are scheduled out and we have to refer out. We do not currently have any COVID patients in the hospital, but that changes on a day-to-day basis. It's in the same situation as Skyline, where we have had to hold patients in our emergency department until we could find a bed available for them, sometimes more than 24 hours. So we have to have staff, extra staff in the emergency department to take those really higher level care patients. Need to go to a larger hospital, but they're just so the not being able to get transfer patients out, but also we're having a challenge placing some of our patients who need to go to a long-term care setting that aren't able to go back home. And so in the two, it's really put a lot of pressure on staff and every every hospital, I think, in the nation. We're struggling with staffing, especially nursing staffing. So it's really a challenging situation. We are keeping our eye on when the vaccine mandate goes into effect, and hoping that the state will have some additional resources, although we haven't heard that those are coming. We're trying to get ready for that to make sure that we can providing services here. You probably have heard throughout the state there are times when hospitals their emergency departments are on divert, and so but we haven't experienced that yet. There have been days when we were very close to that. So that's the situation.
A question, Leslie, this is Dave Sauter. When you say additional resources from the state, can you elaborate what that means exactly?
Yeah, at this point, we don't think any are coming, but that would be National Guard or any other nursing staff that could be freed up. They have a.
I just want to be sure when we're talking about financial resources that it was people.
No, this is people.
Yeah, I assumed, but I wanted to just be clear. So, okay, so that would be help, like as you said, actual to help staff positions. So bodies, humans.
In your statement on the long-term care setting, was that for COVID patients like long-termers, or was that just you need more long-term care spots?
Yeah, so the long-term care facilities are not accepting as many patients. So these are not COVID patients. These are just patients that need care. They're not safe to discharge to the home. And we're just having a challenge trying to find.
Okay.
Our big busy part of this fall has been schools back in session. We have been meeting, I think we took July off, but other than that, we've been meeting every week. I meet with all of the superintendents in the county, with Dr. Person and I, just as a time to kind of really dig into what the guidance looks like. And it's been a really supportive, good group. And so there's been a lot of challenges for a lot of the schools for a lot of different reasons. Obviously, we have some larger schools and some smaller schools. And so just asked two of the schools today to just kind of go through what they're doing within their district, which is kind of the representative of the larger and smaller districts, and how they're working to mitigate COVID. We have not had to date any known cases of COVID transferred within the classroom. We're seeing a lot of spread outside the classroom, outside activities and birthday parties and gatherings. But as far as actual spread in a classroom, we have not seen. So I think it's been a little bit of a rough start, but that continues to be a testament of our, they have amazing school nurses. The superintendents are doing a great job of doing case and contact investigation. And so we've been really fortunate, and we're really hopeful that we can continue to keep kids in school as the governor has mandated for the entire year without any disruption. So far we're on really good track for that. So I don't know, Ellen, are you on the phone to talk about Goldendale?
Sure, thank you. Thank you for the opportunity. Like Erin said, we have been meeting weekly across last year and then this year, and really have appreciated the health department's support. Every time we meet, we learn something new, and I never thought I would have as much medical vocabulary as I ended up having at this point. So really have appreciated that. So we've worked with the health department to ensure that we understand the Department of Health's guidelines for us, as well as just what we need to do here locally. Every question I have asked either Erin or Dr. Person, they're prompt in their replies. And one of the things that I have that may be a little bit unique is I end up also listening to the Yakima group and with their health officers. And it's very comforting to hear kind of the similar things. So we're all in the same boat, but our responses are very similar. So we use masking in our schools. We use social distancing. We make sure that we know where our seating charts are. And then if we do have a case, we end up having to do that contact tracing. We do that all in conjunction with the health department. We've also, because of their support, have started being able to test here in the schools. We don't test without parent permission. That's a requirement. We have to have that parent permission before we test a student. But we started just this week being able to test anyone who has symptoms, again, with that intent of trying to keep them in school as well as keeping people healthy. And then since last year, we've had the ability to do the PCR testing as well, which takes that 48 hours or so to respond. So we are doing as well as possible. We are struggling with staffing. There have been a lot of contact tracing, which has ended up outside of the school, impacting inside of the school, but have really appreciated the health department and all the work that we've done with them.
And one thing to add is that Goldendale was they did a pilot test with the testing within schools last year. And Goldendale was one of 13 schools in the state to be part of the pilot program, and found that it was, not just successful in Goldendale, but in the other schools as well, and then have opened it up. So most of our schools are actually going to have this availability. And a lot of them got on board last spring. So we were really actually ahead of the game for the state. And I think that's just part of our conversations weekly. And we're working on some more innovative ways to help support the schools in partnership with ESD 112. So we're just all continue to try to make it easier for each other in this response. So unless you have questions for Ellen, I've also asked Brian Freeman, the Klickitat superintendent, to talk about his experience in the Klickitat school.
Thank you, Erin. I appreciate you inviting me today, and thank you to the Board of Health Commissioners for allowing me to speak. Similar to Goldendale, our mitigation strategies follow the same thing, except I actually view our weekly meetings as one of the mitigation strategies that we use. The input that we've had from Dr. Person as well as Erin has been invaluable. I've had so many questions, and every question has been responded to in a very timely manner. And I appreciate both of them for their support. We would not be able to safely be in school without those two individuals, as well as the health department employees. So thank you to all the health department employees that I've called on a Saturday or Sunday or 7 o'clock at night. Thank you for taking my phone calls. I really do appreciate it. Central to mitigation, of course, is mask wearing, social distancing, hand washing, sanitation. But another key, and this is something that the parents are doing, it's not sending their kids to school sick. And our parents have done a good job about doing that. So a big thank you goes out to the parents, because that's a partnership that keeps us all safe. The other thing is not coming to school if you're being isolated because you have COVID, or because you're in quarantine. And the health department, again, has been key to that. They communicate, the health department staff communicates to the schools and to the families. And it's very comforting when a parent and myself have the exact same day that student can come back, because we have both been talked to by health department staff. And so that's very comforting. This is our first year for testing. We do both PCR and rapid testing. We're just starting rapid testing this week. Similar to Goldendale, we do not test students unless the parent is present and given, parent or guardian, is present and has given consent. We're going to be gearing up for basketball. It's currently guidance says that a student would either have to be vaccinated, fully vaccinated, or else have testing done and be negative, of course. I'm waiting to come up with a plan for that until we're a little bit closer to basketball at the end of November, just because I don't want to make 3 plans and keep changing them. That one I'm anticipating having parent permission once, that the parents could obviously revoke at any time, instead of doing it instead of parent permission each and every time. But that's going to be a discussion with my school board, as well as the health department and also parents and guardians. I am very thankful for the support. I can't overthank. Unlike Ellen, I'm an ESD 112, and last week I was in 2 meetings with Dr. Person. One was a ESD-wide meeting, and the other was just for our county. Again, just like Ellen was saying from the superintendent from Goldendale, the message that we're getting from our health officer is the same as the health officers in the region in ESD 112. Want to say again, thank you, and Aaron, I try not to call you on Sundays, Saturdays, and 7 or 8 at night, but thank you for again taking my calls.
Always.
Excuse me, Nicole, if you could mute yourself, you're still live. Thank you.
Anyway, thank you to Ellen and Brian, but I actually don't pay them to call and compliment us, but I do ask them to just talk about what's happening in the schools. I think it's important. There is a ton of work. There's not just Department of Health guidance that we're helping them understand. They're also obligated to follow OSPI. They do have in some schools, they have requirements based on their teachers unions. They have their risk management pools. They're in a difficult position in which they have 4 or 5 regulations that they're trying to actually meet. So anyway, so that's been a big part of September. I think everybody's getting kind of in the groove for school. So we're looking forward to the rest of the year. Pending your questions, that's all I have for the COVID update.
Okay. Any board member questions on that for now? Understanding you can reserve the right to ask questions later. So. Okay, go ahead.
Oh, Mr. Chairman, I just have a comment, and that is really a heartfelt thanks for all the hard work that all of you are doing. Dr. Person, Aaron, our school administrators, this is so complex, and all that you are balancing is just amazing. Thank you so much as a citizen of this county for doing your jobs so well. That's it.
Okay. For everybody listening, that was Sue Pennington. She's on the Board of Health. So that was not a citizen comment. That was a board member. I don't want anybody thinking we're playing favorites.
Right. Okay, with that, I'm going to move us along to the influenza vaccine cost resolution.
Yes, so it is flu season time. Every year we do adjust the price of flu vaccine. We are working with a couple of our partners to do flu vaccine clinics coming up in the next couple of months. We typically have, or we have always done cost plus administration fee, which is $25. Last year it was $35. This year our cost plus our administration fee is $25. So, or however that works, our cost is 15, it's 25. It's 40 for the final cost. As a Board of Health, you do have to approve any fee changes. So,
okay, any questions about this before we take action? If not, I would entertain a motion on the resolution.
Mr. Chairman, this is Sue. And do we discuss after the motion?
I need a motion. Technically, I need a motion on
the floor. Okay, sorry. Okay. So
you can make a motion then.
Well, I'll come back in. I have a question for our director.
I guess I would make a motion that we approve the cost reevaluation resolution, bringing the cost of the influenza vaccine to $40. I'll second the motion.
Okay, I have a motion and a second to adopt the resolution revising the fee schedule. Now discussion on the motion. Ms. Pennington, did you have a comment or a question?
Okay, I guess maybe just a comment that I do trust that, I do trust the analysis that's going on, Aaron. I guess I just wish we could keep it to at least to last year's rate myself, because we want people to get flu shots. We want to keep the cost down, and so I just want to make that comment. It's not that I will vote against it even, but to say that we, as a health department, we want to keep our costs as low as we can, and that's all.
So Aaron, is this due to the increase in the vaccine, the flu shot vaccine going up primarily, or is it more on the side of our administration?
We have just always adjusted every year for the cost of the vaccine and the cost of the administration. So it's been pretty fluid. In the past, it's been anywhere from $25 to $50. It was, I think, $50 one year. So
we're not making a profit on this.
we are absolutely not making a profit. We will never make a profit on flu vaccine ever. That's not our.
How many total flu vaccines did we give last year?
I don't know how many we gave last year. We ordered 200 this year, so I'd imagine probably about the same. We typically base the following year's order on what we gave the year before.
I just didn't know if last year's was an odd number because we had the COVID going on.
Nobody had the flu last year.
It's true. We do strongly recommend that people do get flu shots this year. I am concerned about what flu could potentially look like. Flu could potentially overwhelm our public services, our hospitals, even more than they already are. So really encouraging people to definitely get their flu shots.
Are there, go ahead.
Aaron, do you accept insurance?
We do, yes. But we are not a preferred provider with a lot of insurances. So while we will bill insurance, there are instances where they will not pay because we are not a preferred provider.
And then how about Medicare?
Yes.
Okay, thank you.
Well, that's an all-day story.
Yeah, so
Yes.
we'll leave it.
Yes. Yes.
The easy answer is yes.
Yes.
Asterisk.
Yes.
Yeah. Well, I think, yeah.
Yeah.
I think Ms. Pennington's comments are well placed, is that we want to encourage folks to get their flu vaccines, and we want to try to do it as economically as we possibly can. But we also, with that other job I have, we're not making any money doing this, and we have to keep the lights on as far as, so if we're, all I'm interested in doing is covering our cost and make no profit. And that's how we adjust the schedule up and down. I know there are likely, and I don't want to put anybody on the spot, but there are programs. I suspect that nobody that wants to get a flu vaccine can't get an influenza vaccine solely based on that they can't afford it.
No, that we will not make vaccines contingent on your ability to pay. We will vaccinate anyone.
Right. Okay, any other discussion on the motion, which is to adopt the fee schedule?
Just to clarify, Aaron, so could there might be a sliding scale if somebody said, I can't afford this?
I don't know, Sue, that we've ever done a sliding fee scale for vaccines. My understanding is that we've written them off in the past as like a charity care sort of scenario.
Okay.
What percentage was those usually?
I have no, I don't know the answer to that. I'm not sure I could find the answer to that, but I will look.
If you just kind of keep an eye on that this year so that we know next year,
Yes,
that would be
yeah.
fine.
Yeah, no, I don't know that it's ever been tracked.
Right.
I think
That's
it's a
what I'm saying.
solid
Don't
question. to
Spend
know
20
for
hours
next-
digging for something that's probably not there.
Yeah, I don't know that it's there, but I think that's a good metric for next year.
Yeah. Okay, any further discussion on this? Hearing none, all those in favor of the motion to adopt the fee schedule, say aye.
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 Aye. There will be none opposed because that was 5 yeses. Motion passes. Thank you. It will bring us to public, yes,
Before we have
before.
public comment, I would like to make a statement.
Okay, Commissioner Christopher.
Bear with me, I wrote this statement a good month or so ago, and it's about 3 minutes, so. I was very disappointed when our county public health officer, Dr. Person, signed a letter to the governor asking him to reinstitute the mask mandate for vaccinated people. To me, sound leadership weighs all health and safety aspects of all individuals to try to protect everyone. That also means protecting the mental health and safety. Bear with me. As a matter of fact, I don't know that I'll be able to read it. The mental health and safety of the 1 in 4 girls that were sexually molested as children. And the 1 in 6 women have been forcibly raped. All right, I got this. My question is, who's looking out for these people? They got the vaccine, even though they didn't want it, but they couldn't have something over their face, a mask or a hand to bring back memories and trigger panic attacks and PTSD. People that have been relatively fine for years, but now have thoughts of suicide and those rekindled memories and emotions that this mask brings. Moreover, is someone at risk of COVID and its 99% survival rate more important than these people are? Is someone that's 80 years old more important than someone that's 18? I think not. I question who is looking out for these forgotten people's safety and mental health. Mental health is real. Teen suicide is real. Mental trauma on our youth because of this ordeal is real. It's time someone started looking out for them. If we look at our county COVID case rate data that I was presented at the time Dr. Person signed this document, the science, if you will, 96% of the cases were unvaccinated, 4% were vaccinated. The county health department posted all, quote, all of the Klickitat County residents that have either died or been hospitalized were unvaccinated. With that and other data, I see this new remask the vaccine mandate. This is remasking people that are already vaccinated to be nothing more than a policy to promote bullying of the vaccinated against the anti-vaccinated people in each and every office and work state in this state. And I think it's disgraceful. Now, I have taken the vaccine months ago, so don't label me a right-wing anti-vax nut job just so you don't have to listen to my argument. Heck, label me whatever you want at this point. I'm pretty used to it. All I ask is that you take a minute to think about these forgotten people before you bully someone that isn't wearing a mask. Actually, at this point, I want you to look closely at every woman wearing a mask. 1 in 4 or 1 in 6. Was molested or raped. Then understand the mask that they are forced to wear by the governor, even after getting the vaccine, might as well be the governor's hand silencing the screams of their past. I believe this is a pro-bullying mandate that hurts people. I will fight for these forgotten people, even if no one else will. Now, I'm sorry if that hurts some of your feelings or offends you, but that's where I stand. To my point, I sit on the Board of Health. I need solid data to make sound choices to protect the people of this county. Data I can't seem to get as it isn't released by the state and available to the county health director or the members of the Board of Health. Some of that data I need to make good choices on the Board of Health are how many county residents with COVID were ventilated? Were they vaccinated? Ages of county residents that have been put on a ventilator, were they vaccinated? Ages of county residents that have been hospitalized, were they vaccinated? How many residents that were on a ventilator had pre-existing conditions and were they vaccinated? How many residents died had pre-existing conditions and were they vaccinated? Of the deaths we've had, how many tested positive at the time of death and how many tested positive weeks or months before death and were they vaccinated? Did any of the people that died of COVID Did any of them have lethal amounts of narcotics in their system at the time of death? How many residents of this county have died of the vaccine itself? I want the full data on all vaccine side effects in this county. None of that information can I get. Now with COVID case numbers that I was given at the time Dr. Person signed this letter, 96% of our cases are unvaccinated. 4% are vaccinated. In the county Facebook post of all the Klickitat County residents that have either died or been hospitalized or unvaccinated, not counting the facts of the relevant information that I can't seem to get because I'm somehow not privy to. I feel that there are three possible reasons or three possible opinions or options on why Dr. Person signed that letter to the governor to remax the vaccinated. As their own data or science doesn't back it up, or at least what was presented to me. Number one is Dr. Person had the data to make the decision and that we don't have. If that's the case, why was I not presented the data as a decision maker on our local board of health? Number two is Dr. Person has the same extremely limited data as I have and made her decision to ask the governor to remask the vaccinated with this extremely limited data. Number three, Dr. Person makes this decision for political purposes. Now, any and all of these reasons are unacceptable to me. The decision to remask the vaccinated hurts more people than it helps. You may not see these people in the ER, but they are real nonetheless. I have a duty to the elected people to protect all of the residents of this county, and I take that duty seriously. Almost done. With that, I feel it is my duty to these forgotten victims of violence to use this time and my power as member of the County Board of Health to make a motion on the record calling for the immediate termination of Dr. Amy Person as our county public health officer.
Okay. I guess I have a motion. Is there a second to the motion? Hearing none, the motion fails for lack of a second. I do want to have an opportunity for the public to have some time to have access, but I think based on Commissioner Christopher's comments, I would, if Dr. Person is willing and able to answer any of those, I'm particularly interested just taking one piece of information as far as is there any evidence of, has anybody in this county died from being vaccinated?
Not that we're aware of. I've reviewed some death certificates where it was brought up as a concern, and I have found nothing in the death certificates that supported that.
Okay.
Or in the medical examiner notes that I've reviewed or any coroner reports that I've reviewed.
Okay. Dr. Person, anything that you'd like to add to that? You are still muted. I'm sorry.
She's unmuted.
You're unmuted.
Oh, okay, there.
Go ahead.
That's better. Sorry, yeah, I would just to make one comment in response, because masking absolutely is not intended to be bullying of any sort. And also to recognize that the mask order does recognize that individuals who cannot wear masks for physical, mental health, developmental, or cognitive reasons are granted exemptions to that.
And can be fired from their jobs if you can't make exemptions for them.
Okay. All right, well, I think I'm gonna move it. I think this is a lot. I mean,
It's deep, I get it.
I get it. I mean, these are difficult conversations to try to have in a public setting.
These are conversations
that have to happen.
Employees have brought to me and citizens have brought to me.
Certainly. But
I guess for me, the question is, we need to ask the good doctor why she signed that letter to the governor to remask the vaccinated. And if we can understand from her rationale, maybe that would shed some light and help Commissioner Christopher out.
No, nothing helps me.
And I can appreciate that. You know, when I sign this, I'm looking at my role, not just in this county, but as a member of public health within the state of Washington. Due to the Delta variant, even with people being vaccinated, we were seeing a sharp increase across the state in the number of people who were becoming infected with COVID-19, including people who were being vaccinated. We continue to see the overall hospital and healthcare system across the state has been stressed. And that was the fear in August.
Vaccinated.
Please.
That we are continuing to see the large number of cases that we have because of the large number of people we have who are not vaccinated, and honestly to the large numbers of people who don't always follow mitigation, mean that it puts everybody at risk, even those who are vaccinated. Our primary goal is to maintain the health of our healthcare system, because that affects not just people who have COVID, but people who have any reason to be hospitalized. We're seeing Idaho has moved now, not just to northern Idaho, but their entire state is under crisis standards of care, which means that people who have survivable illnesses may not survive because there will not be the resources to help them. That is a position we are desperate and doing all we can to ensure Washington doesn't get to that point. And so that means, yes, we do have to take steps that are hard and are hard for lots of people. So I'm not going to say there is any answer that is good for all. We are really trying to find that balance between ensuring as many aspects of everyone's health as we can.
Thank you, Dr. Person. I think in the interest of fairness, I'd give any other Board of Health commissioner the opportunity if you had a comment that you wish to make. This is your chance. Not seeing any on Zoom, any in the chambers? No. Okay.
Quickly, I would like to just say you may not agree with my opinion on this, but hopefully you understand why I have the opinion. That's all I ask for.
Yeah, I'm going to move us along to public access to the board. We are significantly behind schedule, but I am going to, I'm going to make sure that we have 15 minutes that was allotted for this. I apologize for the other business that we have later, that other board that we serve on, but we can run a little late on that, I believe. So I'm going to go to public comment. I am going to limit to 3 minutes, the same as we do. I will start in chambers. If there's anybody in chambers that wishes to make public comment to the Board of Health, please come forward and give us your name. I will be.
Can I take this off so I can
You
see
can,
better?
you may, you are allowed while you're
Okay.
speaking.
I'm Laura Cheney. I'm from White Salmon. Thank you for hearing me. I'm here today to ask questions and express concerns over COVID-19. Right out of the box, I looked at research today or data on the state website and the county website. I gleaned from that in the county that 1,587 people have acquired immunity in the county. My big question is, how many people have been vaccinated in the county? I didn't see that. And how many people are, I guess on their first dose, partially vaccinated? Does anyone have that answer?
I do, yes. So we've
You do?
vaccinated.
Is that on the county website?
It is not, ma'am. It's on the Department of Health website and they have a vaccination section. I can get you the link to that I can give you that information now, but for future reference, so you can look that up. We've given 22,635 vaccinations in Klickitat County.
Just
So
a second.
to date.
vaccinations in the county is what, 22,000?
Yeah, I'll actually, you can have that.
No,
It's
first
right
and
there.
second.
Can I have this? Yeah, absolutely.
Is that fully vaccinated?
That's complete, that's all the doses that we've given in the county. And then
Okay,
this
that's
is-
doses. That doesn't mean how many people are vaccinated.
We're there, we're getting there. Hang on, I got that too. So this is also so this is what you'll find on the DOH website, and I'll get you the.
Now,
link
is
to that.
this county
So this is-
website?
This is a state website. And so this shows, so if you look at the total population is 44.6, that's everybody out of the county. If you want to look at who.
Now, wait a second, everybody outside of.
Everyone in the county, so like all of our residents, 44% are vaccinated. The people that
Is that
can get
zero
the
to
vaccinated,
death?
like that's 0 to death.
Okay,
If
so
you, like,
what's the number of people?
There's
You'd have to do the
22,710,
math,
I
figure it
think. There 22,700.
About
It's about 23,000.
Yeah, it's like 22,700
About
in the
10,000.
county, residents.
Now, but it's my understanding we only have about 22,000 people in the county. So
Yes.
does that mean everyone in the county is vaccinated?
No, that
no.
takes
That's-
2 doses.
It takes 2
So
days.
we're talking doses, not people.
Right.
Yes,
You know, this is what is so confusing.
it is.
And it's, you know, we personally, all of the people need good numbers to make personal decisions.
Yes, I would,
This is not good numbers.
I.
And
understand.
I think, you know, we do deserve good numbers. Why aren't we getting them?
You could call the state.
Yeah.
Now,
We've
you're
had
saying
the
it's
same-
a
no,
state's fault,
we've had
not the
same
county's
arguments.
fault?
No,
We
because we
can't get
don't,
the information from the state.
You mean,
That's right.
now, you know, this is so confusing because
is.
what you're telling me is the hospitals, North Shore, they're all saying, we're not going to report to the county, we're going to report to the state.
that's
Is that
how
what's happening?
that's how vaccines have always worked.
Can't
so-
Your time is elapsed.
So,
Sorry?
Your time is elapsed. I'm
Okay.
sorry.
you can, do you want to keep that?
Yeah, let her keep that.
Okay. But I hope you understand my point.
Yes.
Yes, thank you.
Okay, I'm gonna go to the Zoom.
Troop was the first.
Okay, and you have raised your hand, Mr. Troop, please go ahead.
Ladies and gentlemen, thank you for having me, allowing me the time to speak. I'm not going to ask any questions because I only have 3 minutes to cover a lot of ground here. But ultimately, I say first out the gate, I would second the motion to terminate Dr. Amy Pearson's position on account of either gross negligence or willful ignorance. As she's stating repeatedly that there are no clinical studies that support the use of ivermectin. It would be pretty simple to do a quick research on the pubmed.nih.gov, where it says in 2015, the Nobel Committee for Medicine awarded treatments for infectious disease to ivermectin, which is a multifaceted drug against some of the world's most devastating diseases. It's been used in more than 20 randomized clinical trials, and repeatedly, over 74% of the time, it has shown a strong correlation to a quicker recovery from COVID-19. All right, so that's that issue there. Along with other things, we're having a high-level conversation, which she likes to talk about having, but not actually having. We want to talk about whether there's 74 active cases out of 22,000 is less than 1/3 of 1% of people in the population that are actually active right now. If we want to look at 1,613 cases over the case July and August, that's a great amount of testing, outstanding, but still that's only 77% of the county population. So the question to the board would have been, what percentage is the annual flu season? If you go to the CDC website and you look at the CDC website and say there was on average in 2020, an estimated 375,000 deaths in the United States due to COVID-19. However, due to NIH.gov, the average death rate is 389,000, which means on average, more people die, 389,000 from the seasonal flu than actually die from COVID-19 at 375,000 deaths in the United States in 2020. And that's not accounting for the fact that COVID-19 somehow mysteriously replaced the entire flu season. So that's a whole other issue altogether. What I'm pointing here and poking holes in this entire propaganda argument where everybody's talking in lockstep and reading from their scripts is the fact that there are no studies that actually show there is a crisis going on here. So let me, in the end here, go ahead and come back to somebody who is more knowledgeable myself. In fact, I'm going to quote Dr. Martin Kulldorff, professor of medicine at Harvard University, a biostatistician, epidemiologist with expertise in detecting and monitoring infectious disease. Dr. Sunatra Gupta, professor at Oxford University and epidemiologist with expertise in immunology, vaccine development, and mathematical modeling of infectious disease, and Dr. Jay Bhattacharya, professor at Stanford University Medical School, a physician, epidemiologist, health economist, and health public policy expert. These gentlemen, in consensus with 860,000 other doctors, come out and say, why are people so afraid of COVID-19? Unfortunately, and I quote, unfortunately, the public health messaging around COVID-19 around the world has created many misperceptions that have spread fear. We understand that. The public health messaging is intended to spread fear, or is maybe unintentionally spreading fear, but I do say I believe it is intentionally spreading fear. Those who are not vulnerable should immediately be allowed to resume life as normal. People who are—
Time has elapsed.
Wow. Okay, well, I hope you do listen to the good doctors that actually do have some credentials and actually are speaking truth on this.
Thank you.
You can look at the great
Thank you,
parenting declaration if you want to educate yourself, or we can have some more conversation. Thank you, gentlemen. Thank you. Appreciate
All
it.
right, I'm going to go back in the room. We are still in public comment for the Board of Health. Yes, please come forward. You can—
Susan Kelsey, Goldendale.
Thank you.
And am I addressing just the board and then she can answer me, or can I talk to her?
Who is her?
Erin?
You're addressing the Board of Health, but
Okay.
she's staff to the
I'm
Board
here.
of Health.
Okay.
So she's right there. Go ahead.
Robert's rules, you know.
Yeah, I know.
So what I'm concerned about is the messaging from our health, not just in the county, but nationwide, is that the vaccine is the only answer to stopping COVID. And I never really see any type of other messaging on treatments. Now, we've heard in a general sense, the ventilator, but those two things seem to be the national messaging. And so my question is, when I go to search other venues, there's a series of other things that seems to be helping. And one of them was mentioned earlier, which is the infusion,
monoclonal antibodies.
Right. And so you're not really hearing a whole lot about that this last year and a half. We have in the last month. Has that been widely used as a treatment, as well as the other things that I'm hearing from other doctors who seem to be being suppressed? And in that, you can understand why us people are very concerned that the messaging is hurting everyone towards a shot rather than treatments.
I think your point's well taken. I appreciate you sharing that. I feel like we have failed about talking in monoclonal antibodies. They have only been available in this area at Skyline. I think they were kind of the first ones that have done it. I think MCMC is now as well, but at first Skyline was the only place that was doing it. So there's just been really limited access, but certainly we could speak more to that in future references. We want everyone to get a vaccine. I think that's the best way to end the pandemic, but understand that's not the right choice for everyone. And I have always, tried to message, like, if you can't get a vaccine for whatever reason, it's your choice. Then you can wear a mask. If you can't wear a mask, get a vaccine. If you can't wear a mask or get a vaccine, consider social distancing. So I think, to your point, there are options, and I do think maybe we haven't messaged it like that because we know vaccination is working, and that's the most kind of effective way that we can get to the immunity.
Time is
So,
elapsed.
sorry.
Okay.
Hopefully that helps, but we can certainly talk more about.
Okay, I saw,
Gabrielle Gilbert was the next one. Right?
was she the next one? Okay, Ms. Gilbert, you were the next one you were next in line who raised your hand.
Thank you. I want to speak directly to Commissioner Dan Christopher. I find that your statement of your letter about rape and survivors of sexual abuse is completely it's hypocrisy at its best, considering you're on tape from September 14th, loving a poster that equated mandatory vaccination with rape. So you cannot play two sides of that field. And it is incredibly traumatizing for survivors of rape and childhood sexual abuse to listen to those crocodile tears and to listen to that letter. What's more, it is important that this community understand that there are many thousands of us in the county who support the health department, who support the doctor, who support the fact that this virus, COVID, is a virus. It is not the flu. And these kinds of data points that are lockstep brought to us about treatments that are not proven, and these doctors that they cite to push their agenda, we reject them because we are living in this reality, and that is surviving COVID in a pandemic here in the county. I work for nurses. I babysit their children while they sit in that emergency room working long shifts, saving COVID patients. Some of them are applying CPR 3 times, chest compressions to keep a person alive. It is so disrespectful to have people attacking the Board of Health and our doctors, the doctors that are associated with the Board of Health, to come and ask for their resignation. It is disrespectful and we do not accept it. And we will stand in support of the hard work and the tireless work that they are doing. Thank you for your time.
Thank you, Ms. Gilbert. I'm going to go in here. Okay.
Kathy Moko, Goldendale. I have a question about acquired immunity. There's no discussion. You never see any numbers about the people that have had it. And then if you've had it, should you get a shot?
You should, I think, and I don't know if Dr. Person is available to talk about percentages, but we know that you have natural immunity for up to 90 days after you've had COVID. And I think if you have had COVID and then the vaccine is your best immunity, as far as, I don't know if Dr. Person, do you have the actual statistics on that?
She's still there. She's unmuted.
Sorry, I don't have those numbers immediately on hand. We do know there is some protection from natural immunity. We also know from the studies from Israel that people who've been infected and then who've been vaccinated have even more durable protection. There's studies that have come from the hospitals in Texas where they've done most of this work that have shown that people who have been vaccinated have had better protection. Some of this is pre-Delta, so it is an area where we are continuing to monitor. So again, we know there is protection from natural immunity. We know the best level of protection so far that we're seeing are people who have been infected and have then been vaccinated.
Okay, Gigi, you are next. And I want folks to bear with us. I am going to shut this down and I'm going to take 2 more comments, and the Board of Commissioners needs to reconvene its meeting. It has a packed agenda.
Quick recess.
Yeah.
I can take an hour. I can
So Gigi, go ahead.
Thank you. I won't take very much time. I just wanted to express my gratitude to Dr. Person and to the Department of Health for continuing to protect the health of the public. As a healthcare provider for over 35 years, I know how difficult prevention is and how important it is. I know that there are exceptions for people in terms of who can get a vaccine and who needs to mask. And that's why we have now food delivery systems and lots of other ways for people who can't mask to be able to access the necessities. So I just wanted to express my, again, appreciation and support for Dr. Person and the health department. Thank you.
Thank you.
Bill is next online if we don't have any more in the room.
Can we revisit something?
Lynn,
Or I
Bill,
only
and
get one
Aaron,
time?
Still got it.
Okay.
2 people left.
Okay, we'll go ahead and go ahead, sir. Bill, I'm assuming. I suppose I shouldn't.
Bill, are you there? You gotta unmute yourself.
*6 to unmute, please.
Or not.
Or not. Okay, then Lynn, you get the final word.
Not.
Thank you. This is Lynn Mason. I'm in White Salmon.
Go ahead.
Thank you for the final word. I just want to say thank you so much to all the healthcare providers in our county and in our region. We really appreciate you. And, you know, as far as Commissioner Christopher's letter, as a woman, I'm highly offended by that, honestly. I think it's gross. And I feel like it's being used as a tool to abuse our healthcare providers, actually. And they've gone through enough already. They're working very hard, and most of them are women. And I feel like that's using a tool against women, and I don't like it. The bottom line is, with all these facts, I'm not a doctor. You know, I'm going to leave it to the experts, so I'm not going to talk about false facts or anything like that. But I believe they are trying to keep us from having a healthcare collapse. So it doesn't matter what numbers you throw out there, what rationale you have, what facts you've dug up from whatever internet thing you've been on. The bottom line is our healthcare system can only support so much. And that's the bottom line. And so if we don't keep people from getting sick in large numbers, our healthcare system goes into collapse, like we're seeing in Idaho right now. So that's the bottom line. I appreciate all they're doing. I hope that you hear us from out here, that there are people that support you. I'm really happy with all the hard work you're doing. And I can't imagine what you folks are going through. We appreciate you. I hope other people in our county will come to their senses and helping support you as well. Thank you for your time.
Okay, for the record, I was not attacking you or healthcare workers or any part of that in my state.
Okay, I am gonna move this
Hi,
along.
this Bill, can I speak? Oh, this Bill Anderson?
Yes, go ahead.
I just have a.
Get the last word, the last word.
Okay. Why is Nigeria, with a population of 206 million people, and have a death toll of only 3,569 people as of yesterday from COVID? And their vaccination rate as of right now is a 0.01% vaccinated. But they do take ivermectin and hydrochloroquine for river blindness and malaria and parasites and all that. They take it on like a weekly basis over there. I have lots of friends over there, and I talk to them, and none of them are wearing masks over there. Just the government's the only ones that are wearing masks anymore, but they don't have any kind of a death rate like the US and not being vaccinated. I'd like to know why this stuff's not working. Ivermectin and hydrochloroquine seems to be working for them over there. I think it'd be safer to move to Nigeria. Thank you.
Okay, thank you. Okay, I'm going to close public comment. I apologize for folks that were waiting in line, but we simply have no more time. I am going to, so I would look for a motion from the Board of Health to adjourn.
Second.
Okay, I have a motion and a second to adjourn the Board of Health meeting. Any discussion?
Yeah.
Hearing that, no, I'm sorry, sir, from a Board of Health members. All those in favor say aye.
Aye.
Aye. Any opposed? Motion passes. Thank you. We're adjourned. I want to thank people for a very civil discussion about a really tough topic.
Before we restart Board of Commissioners,
Can we take
5
yes,
minutes?
while we reset?
Can you send me that information, please? Yes, okay, great, thank you. Sorry.
for your patience. Is there? I have. SBDC, the small business person, is going to be meeting. One day a week.
On that topic in a meeting, and I wanted to tell you, I really appreciate you advocating for this. I called over, I heard from her that she was looking for space. I called over and I talked with Public Works to verify that those 2 meeting rooms are still as available as I've always believed them to be, those conference rooms. They said absolutely. Is there any reason why she would have a hard time being able to schedule those? I said no problem. We know who this person is. We can get her. In fact, what he told me is that she's able to have that meeting room every Friday, the entire day between now and the end of the year. So I believe that to not be an issue.
Okay, I hope that's true.
Yeah, and I do too. You know, we have a protocol within the CSC facility. Our COVID protocols are very strict, and there wouldn't be a way for me to be able, like, as the compliance officer for that facility, it's not something I would feel comfortable doing, having that be open, like, meeting space, like, are they in compliance or not? Instead, you know, I, like I said, reached out, talked with Public Works.
Is that mine?
No,
Oh, yeah. Don't answer it.
No, it's a timer. She absolutely had access to that, and she has. I know that sounds.
Okay.
It's my timer. So I don't, for everything in life.
Okay, good. I hope so.
I'm like, Siri, set a timer. That's the sound.
It wasn't my wife.
No, it was just a timer.
Oh, okay, good.
Yeah.
Okay, I will,
Kind of the good fun stuff.
yeah.
It seems like a hard transition.
Yeah. Go ahead. I will call the meeting of the Board of Commissioners back in session after our recess for the Board of Health. Go ahead. Our next order of business is new business. WSU Extension Office 4-H Program Manager. That's quite a title. Abby will, with a request to the Board of Commissioners to proclaim October 3rd through the 9th as National 4-H Week throughout Klickitat County. So that is great. So make your request. I don't think it's going to be a hard sell, but.
And I would like to introduce you to Abby Brandt. I don't know if you've all had the opportunity. Mr. Souter, of course, you have as
All right, you gotta
chairman.
stick the mask down so I can see your face.
Yeah, the same face on Zoom. Yep.
Well, it's because you see people on the street and you're like, I have no idea.
I have no idea.
Mr. Christopher, I know the two of you are acquainted because the three of us serve on the Child Care Committee. And Mr. Anderson, Abby Brandt. She has been our 4-H manager for the last 3.5 years. I am also the county director in Skamania County, and Abby proved herself to be quite the talent there. And although I got myself in trouble in Skamania County, I recruited her from Skamania County here. She came with some grant funding, which we particularly liked. and she's continued. And she's continued to work hard on that. Yeah, I wasn't that popular with their Fair Board when we attracted her to Klickitat County, but she's done a great job here for us. And so after an introduction, go ahead, Abby, and share with them about National 4-H Week.
Yeah, so National 4-H Week is like it sounds. It's a national celebration of the history of 4-H with over 100 years of being a youth development program in the United States. And this is simply a formal recognition of that and celebrating the history here in Klickitat County. I believe that you guys have a copy of that.
Yes. I think she wanted you to read it.
I will do that.
You guys can fight over it.
So, yes. So the National 4-H Week proclamation, I will go ahead and read it into the record. Whereas 4-H is America's largest youth development organization, having supported almost 6 million youth across the country thus far. Seems like 6 million in this county as well.
Yeah.
And whereas 4-H has helped thousands of youth in Klickitat County to become confident, independent, resilient, and compassionate leaders, and whereas 4-H is delivered locally by Washington State University Extension, which is part of a community of more than 100 public universities across the nation that provides experiences where young people learn by doing hands-on projects in areas including health, science, agriculture, and citizenship. And whereas National 4-H Week showcases the incredible experiences that 4-H offers young people and highlights the remarkable 4-H youth in Klickitat County who work every day to make a positive impact on those around them. And whereas 4-H's network of volunteers and professionals provide caring and supportive mentoring to all 4-Hers, help them to grow into true leaders, entrepreneurs, and visionaries. Now, therefore, we, the Board of County Commissioners, do hereby proclaim October 3rd through the 9th, 2021 as National 4-H Week throughout Klickitat County and encourage all of our citizens to recognize 4-H for the significant impact it has made and continues to make by empowering youth with the spark that grows into the skills they need to lead for a lifetime. And with that, I would certainly support a motion to adopt that proclamation.
So moved.
Second.
Okay, I have a motion and a second. Any further discussion?
Other than they left out the line of whereas if you don't support this, it's probably more deadly than COVID.
Yeah. Okay, that will be in the subtext. Any other discussion?
For the good now.
No, all those in favor say aye.
Aye.
Aye, motion passes. The week is hereby proclaimed. So
Thank you.
We'll sign the
Is it the
originals.
Same week every year?
It's the first full week of October every year, so the dates will change, but you can look forward to seeing us next year.
And if we were ever to forget, which, you know, you can imagine is our National 4-H Week, we often won't, but Lee is so diligent in saying, make sure that you get on the agenda. Lee, we really appreciate it. Thank you very much. She helps us with that every year. So I also asked Abby to prepare, just being mindful of, you know, time constraints, but I asked her to bring an impact report and then also to share just a couple of the monthly newsletters so you get an idea of the type of programming offered. So if you have any questions for Abby about the 4-H program, please feel free to ask her now or review the information, reach out to her another time. But I just wanted to give you guys a little bit more insight about what that program is, what it looks like in Klickitat County.
Okay.
Absolutely. Commissioners, would you like me to pass these to
Yes,
you?
please.
And Lee, I have a packet for you as well, if you'd like.
Oh, that's smart.
Lee has trained us so
Yes.
well. I don't know what we do.
Packet to her is far more important than us.
We'll have a good
She
backup
gets it
too.
to us.
Yes.
One of the things that I would share is that clearly through the pandemic, you know, there has been a significant shift in the types of programming that we're able to do. But I do want to share with the commissioners here that in Abby, you really do have a fantastic 4-H program manager who worked tirelessly to come up with innovative ways that instead of saying, we can't meet in person, I guess we can't do 4-H. She worked very hard along with our 4-H regional specialists and our other regional 4-H coordinators and myself. We met every Thursday, strategized about how to bring quality programming to the Gorge region, and despite the limiting factors, the mandates, and the need to be virtual, and then also how to think about not being able to be in person, but also wanting to try to limit the amount of screen time that we knew kids were definitely having, trying to do schooling predominantly online this last year. So just a fantastic effort, very innovative. And if you have some questions on the things that are included here in some of these impacts, please don't hesitate to reach out to myself or to Abby.
I see your 4-H newsletter here. How many people in the county are actually signed up to receive that? And is it online or is it actually mailed to us?
So currently we're a little limited in our distribution of that. If we utilize our 4-H online enrollment database to send that out because it has all of our family's contact information. And more specifically, it sometimes has contact information for the youth that request to receive the information in addition to their parents. We've got some pretty independent teenagers who are so responsible for their programs that they want to know what's going on. So we send that out through our enrollment database, and then I also have a list of community contacts and partners that have requested to receive that as well. And Commissioner Christopher, I heard that you were interested in being on that list in the future, possibly.
That's what I heard in that.
Yes. So when we get our October issue out to celebrate the new year, which will include that the commissioners were kind enough to recognize our proclamation, I'll make sure that you're on that secondary list of people.
Thanks.
Yeah,
I don't mind being secondary.
it's okay.
So in terms of a look at the numbers, it says 5 graduates. Is that 5 graduates of the 4-H program, or what are they graduates of?
So that would be individuals that have graduated out of the 4-H program. It probably also means that they graduated out of their school district, whether that was high school completion, CED, a GED, or they may have graduated last year, but this was the year that they aged out of the program. So we ask volunteers at the end of the year to provide us with a number of pieces of data. One of those is who has left your club because they aged out or they graduated and have moved on to college. And then what are those individuals doing? So we don't have a 100% report rate, but of those that have said, I had someone leave the club because they aged out or they graduated and have gone off to college. This is what those individuals are doing.
And with their permission, we highlight those success stories through our program, most of whom started the program when they were in the 4th grade and are program completers all the way through.
Yeah, if I can toot the horn of one of our young individuals, one of our graduates this last year, Brandy Vance, her mother Julie Vance and grandmother Pat Shammick have been longtime volunteers in this county. And Brandy was actually awarded Outstanding Youth Leader for Klickitat County and is being recognized by the Washington State 4-H program for her contributions over her time here in the Klickitat County 4-H program, and also as a leader on like the State 4-H Foundation Board as a youth advisor.
Anything else? All right. Well, great.
Thank you all.
Thank you.
Thanks, Abby. I'll trade out.
Yeah, trade out. We will now move us down to our budget workshop.
All right, shifting gears again. Thank you very much for accommodating, allowing us to be able to, to be here to present and one opportunity together. Jen, thank you for your help and being accommodating to be here when this wasn't a normal scheduled time. And Lee, as always, thank you for your help with this as well. I don't know that you've had the opportunity to meet Erica Beasley. Erica Beasley is our new office manager who is doing an absolutely outstanding job.
There we go. Okay.
She's doing an outstanding job, and so don't be surprised when and as Commissioner Sauter knows, I am always trying to increase the capacity and the offerings of our extension office. I understand, and I want to be respectful of the budget conditions. We're here today to talk about a 3% reduction and where those are going to come from, and so but please do know that in the near future, I do feel strongly about being able to make the case that we will need to bump the office hours of our office manager up in order to be able to bring on new grant funded positions to be able to help serve the community. But we need that capacity in an office manager. We can really feel the difference between having somebody there 40 hours a week and 24 hours a week, even as competent as Erica is. So she's doing a fantastic job for us and has done great work on shifting through, budget details and preparing a lot of the documents for you. And so would you please, Erica, would you go ahead and pass that update out to the commissioners as well and to Lee? So I did, of course, submit my my budget memo, and I normally would kind of, take a run through, but I know that you don't need me to read this to you. In the interest of time, please, if you have questions about anything that I've submitted here, please contact me. I would be more than happy to provide more detail or answer more questions. Where that update comes from is after submitting this memo, Jen was able to help us by pushing back our vehicle renewal replacement dates. We feel very comfortable doing that. In fact, we were asking as a strategy to decrease the amount of funds that we would need to reduce in our budget to make that 3%. We felt comfortable knowing that we weren't able to travel as we normally have been in past years, that we're not putting the miles on during this global pandemic that we normally would. And so that being said, we felt comfortable pushing out our renewal dates. And with that help, we were actually able to take a budget reduction of $3,144. So that left us with $1,398 to cut for our 2022 budget, making sure that we were accounting for a 3% reduction from our 2020 actuals.
You have 2.5 employees, right? Or 2.6. How many employees do you have? I don't have that sheet.
Yeah, so that's a really great question, and it can vary from time to time. So right this very second, Abby, full-time, Erica Beasley, part-time, and myself. Now, depending on.
Are you in our budget or are you in WSU's budget?
So there is a memorandum of understanding that accounts for contributing a portion to the county director's fund within WSU. So you contribute to the funds that go to provide my serving.
I
not
actually
only-
had a different question, but it led
Oh, sure.
around to that one, so here we are.
Sure.
I see 2 vehicles. What do you use the vehicles for?
To provide services across our large county. So one of them is in the at the Pioneer Centers, kind of where it predominantly stays. The other one is up in Goldendale. And you know, when we are not in a pandemic, both Abby and I, it's important to us to make sure that we're providing services not just in White Salmon or not just in Goldendale, that we are really out providing opportunities out in Bingleton or Glenwood or Trout Lake. And so we travel throughout the entire county, but also, you know, with permission, we are from to take the vehicle out of county, we provide training and programming outside of the state as well. So if we're going to professional development opportunity, we might take the county vehicle, but we would submit the proper paperwork to be able to take the county out of the vehicle or out of the county, the vehicle out of the county. And so on
How
asking
often
about,
do you run out to places like Bingleton and, you know, because they're not closed. So
they're not closed, yeah.
I mean, you're out there.
In a
quite bit,
normal year.
Yeah,
In a
right.
normal year.
Right,
you
yeah,
do
in a normal, like,
accomplish most
yeah,
of it
Bingleton's a
well.
great example, yeah. So we have a crop improvement association that meets several times a year. And so that gets me out there. We often actually meet at the Bluebird
I forgot
Cafe.
about that one out there,
Mhm.
yeah.
And then we also have the wheat variety trials that take place out there. So one of the things that happens is as we have a need for programming, one of the things that's been happening frequently is that, you know, grape growers, people are purchasing 10, 20 acres. I want to go grow grapes. So when we're able to offer in-person programming again, that's going to be one of my next programs that I'm offering. We did a very robust cider program that was kind of the jewel of the state.
I
pulling
wasn't
in
even
from
thinking those programs. I'm
Right.
thinking literally 4-H at Bingleton High School and how many kids could possibly in that. But I
Right.
forgot you did all the crop stuff.
Right, absolutely. Yep. And so I'm doing, I'm actually faculty going up for promotion this next year. And I am faculty in our community and economic development unit, but I'm also doing work in food systems and some work in agriculture and natural resources. So really, the reason why I wanted to switch my academic home is that I feel Klickitat County needs more from me than just ag and natural resources. For example, you know, work on childcare committee or you know, or there's a number of different types of components to the work that I'm doing that I felt like a broader umbrella would be helpful with. But the work, there's so much that needs to be done. That's why it's important for us to be able to bring people on through grant funding and potentially even through commissioners' funds in the future. For example, master gardeners. We would love to have a master gardener coordinator. Now, I know that's not the right time to come to you and ask for those things, but you know, since I got here 5 years ago,
Read the room.
Right, exactly, and I am. So since I've been here 5 years ago, you know, I have immediately worked to try to understand what are the concerns, what are the needs, and then how can we help fill those? And a big part of that is through more capacity with more hires. And so, you know, we hope to be able to talk more about that in the future, whether that's grant funding positions or whether that might actually be a request to commissioners when our budget looks more appropriate to ask for some increases like that.
Can I ask you what some of these budget things are, what some of these work is? You have WSU Extension Professional Services.
So that's the contract with MOA, the MOA contract to WSU.
For part of your wages.
Yes. And that's annual, and it does tend to increase a small amount each year.
Take your time.
All right.
Jeff's in no hurry.
Different later, right? I think that was it, but let me look at any other questions.
You're talking about new grant opportunities to bring someone up to full time. Do you have those grants in hand? Have you just applied for them while you're out getting them? Where are we at with new grant opportunities?
So one of the things that happens is people say, hey, do you want to have a new person in your office? And I think, do I have the capacity to be able to provide them the support that they need? I do have the vehicles, right? But do I have office space available for them? Do I have support staff available and to provide what they're going to need? And then do I have the capacity to oversee more folks? So in the last year, I did bring on a grant funded position to do mental health and suicide prevention work in Klickitat County. That grant has now lapsed, but we do have some funding that was just approved from the Washington State Department of Health. We're working on getting those budget numbers through WSU and being able to hire for that position. And I had mentioned the successful grant application of $5 million, part of CARES funding around butchering facilities, that $300,000 was actually able to be allocated into operations in Klickitat County. We are going to hire a 0.5 person, and I was approached by WSU as a leader on that team saying, do you want that person to be housed in your office? So I have to think about that. Do I have the capacity to bring in a person? But the thing is, it would be a statewide position. But we all know that when you are the host for a statewide position, the location site gets plenty of attention. So I'm very interested in that, but a limiting factor really is, do I have the support to be able to bring on more folks?
Other budget questions? No, I don't have. You met your 3% reduction.
Yes.
So what more can I ask?
Thank you. Thank you. And you can see that we did take that out of travel and fuel. Those were areas where we felt comfortable this year, and with the budget with the vehicle renewal, we felt comfortable this year, but those are things that we hope to be able to add back in next year. Okay.
We'll save those for next year's discussion.
Okay. All right. We'll do.
I didn't know this year's discussion was over.
Oh, it's not. Well, it's never over until the end.
It's over.
I asked today, that's not your last
No
chance.
further questions at this time.
Right,
Your Honor.
I was just trying to understand where that number came from. When I looked at your overall expenditures, I had 184,725. I did the math. That was a little over 5,000 versus I'm coming down here with your numbers are from your sheet. I'm at 4,500.
So our 2020 actual was $162,866.94. So 3% of that is 4,886.
Okay, I'm just looking at your different sheet. That other set of books.
Yeah, and
your payroll is different because you had approval to hire, you just hadn't hired. So you didn't spend the funds then, but it was already approved to be there. Right? It was an unfilled position, so
there's some salary accruals that the county will be enjoying, being able to utilize elsewhere.
Okay. Okay, no more questions at this time.
Please feel free to reach out if there are. I'm happy to talk about our programs. I'm really proud of them. I think that our team's doing fantastic work. Please let me know if you have questions.
thank you guys.
Thank you.
Thank you.
You're welcome aboard.
Thank you.
That brings us to Department of Emergency Management Director, continued discussion concerning Emergency Management Department's revised structure.
Catching up.
We're catching up a little bit, but don't feel rushed.
Yeah.
It was a packed day.
I noticed that. Gotta get it going here.
They're leaving you out there.
Yeah, sounds like.
Backing you up.
Right.
Far back.
He can give it to me anyway, huh?
You're welcome. Two electeds in the house. Too, so I start getting nervous. Go ahead.
You're
fine.
getting nervous, or I should be getting?
No, you're fine. Now make it 3. So.
Yeah. Okay, good afternoon, gentlemen. Back again to talk about the Emergency Management Department Structure Review Panel Recommendation and the additional data that you requested from last week. The packet that I handed out, you can see the front sheet is the same data that I gave you last week for the recommendation of 3 new FTEs for communications officers, promoting 1 to lead and promote 1 to a supervisor. Nothing on that sheet has changed, but we just reformatted it so it was easier for you to see that simple data. And then the next sheet is the actual overtime and comp time, wages and benefits at the top, broken down into the last 3 years, 2 years full and this year to date. And those are some of the cost savings that we expect estimated, not the total amount, of course, but some of that would be saved in overtime to fill shifts when we have vacations and we have empty positions and people in training and so on.
So this number, excuse me, for 2020, that is it says year to date through September 14th.
14th, yeah.
Wow.
That's correct. That was,
KC
helped me with that number last week.
That reinforces your.
Yes, sir.
That there's folks working a lot of they're pulling a lot of extra shifts.
That's correct. And as you can, so go down the sheet to the next section, it talks about the turnover. And then if you go clear to the bottom, you'll see kind of what the result, why that overtime is built in there. Historically, the open positions, including training time and so on, how we get to those overtime numbers when we're short staffed very quickly. But going back up to the center, department staffing data 2015 through current, there's been 20 staff turnovers total in the department. That includes 1 director, as I came on as an interim director in 2015, and the director at the time left in March of 2015, I believe. 2 administrative assistants, 17 communications officers have come and gone in that 5 years and 9 months. 5 of those communications officers were washed out during training or probation period for various reasons, mostly because the job just wasn't a good fit for them. They weren't able to do the job. That this job is not the stress as well as the shift work and the multitasking that needs to be done. That was a total of 29% of that total 17 comms officers. 8 of those communications officers over this time period left to take quote unquote regular jobs, Monday through Friday, something that's not shift work and not at the stress levels that we have answering 911 calls, presumably. There were a few of those. I think, take my notes, I don't want to work right off the top of my head. There were 3 of those folks that did leave to go to other centers. But by and large, like I said, 47% of the communications officers that left in this time period went into the workforce with normal work hours and requirements. And then at the bottom, the historical numbers for open positions. You can see the years listed there, how many communications officers we had out for how many months in that year. And as you mentioned, Commissioner Sauter, this year to date, 2021, been down 2 communications officers for 6 months total. Not running straight, but 6 months over the entire year so far, and 1 comms officer for 5.5 of those months so far. And then when we allow for 2 people to be on vacation at any one time, and then we have surgeries, medical leave, spontaneous, whatever it might be, that gets us to where we have to fill a significant number of shifts to cover, with just 10 comms officers to cover 2 on 24/7. Yes.
question. And I don't know when the appropriate time is. Because I think it's going to inform the whole discussion. And as far as I know, we haven't actually released or got into the data yet, as far as from the survey results from when we looked at comps and whatnot.
the
Because
employee
we are
survey.
starting with, there definitely is going to have an impact. And so hopefully that's going to be something you're going to be involved in as well, as far as when we are really, I'm looking to, oh God, I'm looking.
Hiding
Behind
behind
the
the
pole.
post.
It's like, is there somebody over there? Okay, that's what
The
yeah.
numbers are only a guesstimate.
At this point. Okay. Because that will definitely have some impact on the,
Good point.
I mean, it could, as far as, recruitment, retention, and,
Yes.
and depending on what happens with the
Correct.
numbers.
Yes.
Okay.
Any,
When are we anticipating releasing that information?
I want
Never
to be clear, this is the employee survey data that you're talking about?
Negotiation.
Oh, that.
after
The numbers I gave you today.
Yeah, that will be
Probably
after
not.
negotiation.
Oh, okay, never mind.
Don't get me in trouble now.
Part of collective bargaining, I mean.
Okay,
Is this gonna be part of that?
no,
No.
no.
Okay, question for you. So, it says total overtime, holiday overtime, comp time, and then you've got actual wages, benefits. How did you break out those benefits? Was that just, are you subtracting out, the benefits that they're getting, like whether it's insurance, those are benefits that, no matter what, it's the same amount.
Yes, and these are all estimates for that benefit part, just because on an average, because everybody gets a different percentage, right? So we had to average that out. But like I said, these would be numbers that will, some of which will be offset when we get to the schedules, which I handed out, and I have more the sample schedule that we talked about in that staffing model, that we get down to what is really the important thing, I believe, to try and avoid is overtime shift coverage. So the shift coverage side of things, when we absolutely don't have anybody else eligible to work because we've got people working day shifts and night shifts on two different schedules, on a series of 2 days on, 2 off, 3 on, 3 off, on 2 different teams. So in any given month, there's only certain people that can cover for other people on the opposite side of the schedule, or the opposite team. And so we're looking at those specifically, the overtime to cover those extra shifts, I guess you'd say, the coverage shifts for people being absent or having an open position or someone still in training and so on.
The way I'm looking at this, just erring on the side of caution, is he comes up with 150, 160, 140. In overtime, I don't think you're ever going to eliminate overtime. If you can eliminate 2/3 of it, fine. So even if you're, say that's 2/3 of that is 100,000, and he's asking for 200,000, it might be a difference of 100 to gain 3 employees and actually do what I think is needed to fix a department. And if that means we need to find that 100,000 from a different employee in a different department, I'm willing to make that call.
And I would agree with the assessment that we're not going to save all that overtime. There's no way. What percentage of it? That's too hard to predict as well. But we will continue to do our best to minimize that overtime. And like I said, the panel came to the agreement that this was the best long-term solution for the viability of the department to succeed. But that's
What do you got for other options?
The
This is
other
the
option,
Cadillac.
yep,
Let's see
Well-
the Kia.
yep. The other option would be to hire 2 new communications officers instead of 3 and promote 1 additional lead. So you'd end up with 2 leads and 10 communications officers. The org chart that I showed you before, you would eliminate the communication supervisor's position from that. You
In
want to go,
one of the new FTEs.
that's correct.
So the FTEs are roughly 65,000 apiece plus the supervisor. 68,000.
You want to go there?
Before benefits.
We will go there. I'm prepared to do.
No, that's wages and benefits according to his math. So that would drop at 68,000. That would drop his number down to
I'll show you right here.
139.
That's pretty close. I like it.
Change, sorry, I didn't have the change.
Look on my back. You're staying way back there. So this is another option that we discussed, but not brought forward. I hope my panel, my fellow panel members don't disagree with me, but I did prepare this package just in case. You can see the org chart on the first sheet. Shows the structure without the supervisor, communications officer supervisor in the org chart. But again, you have 2 leads and 10 communications officers, as well as the 2 casual positions. So that is achieved by, as I mentioned, hiring 2 entry-level communications officers, promoting 1 of the current staff to a 2nd lead. That gives us the ability, as you can see from, we'll go past the 2nd sheet, which is an actual schedule. Same kind of data that I provided before last week. Go to the 3rd sheet for the sample schedule. You can see we have 2 leads that, unless they're needed to fill shifts, they're on a late swing, which is 12 noon to midnight. So again, they are there for half of their team's daily shifts. And because there's 2 of them, then all of our folks, which doesn't happen currently, you get to see someone, a supervisor or a manager, on every one of their shifts, and have somebody there as a supervisor for half of each of their shifts. Until those 2 leads then have to start filling in shifts, and that changes as we get shorter and shorter staffed. In the current situation, they would be working regular days and nights, given our staffing, once we're down to 2 or 3 people. So, and more sample schedules, you can see, and what that does as well to the overtime, as well as our new chief of operations, which isn't in this comms officer schedule, but that chief of operations, keep in mind, to be able to fill shifts as well. You can see after all those sample schedules, the next sheet, the structure review panel recommendation B, as I called it. Real close to Commissioner Christopher's guesstimate of $137,465 increase to the annual budget by hiring 2 FTEs and promoting 1 lead.
Would you anticipate with that any reduction in the overtime? Again, I understand, yes, I would assume.
Yes, definitely. What this will limit is the amount of work that can be done behind the scenes, especially when we're short-staffed, to keep the center running and updated. The management work that needs to be done to conduct day-to-day operations by eliminating that supervisor's position. basically have one more supervisor than we do now. The benefit would be that if we were fully staffed and fully trained, then those two leads would be able to do that supervisory duties. When we're not and they have to fill in regular shifts, then on the console, taking 911 calls and dispatching emergency radio traffic, it's like trying to do office work. At McDonald's drive-through window, you're always getting a phone call, always getting radio traffic, you're always interrupted. So being able to work on any meaningful projects, staff evaluations, so on and so forth, gets complicated.
Is option 2 going to give you the time that is needed to come up with future revenue sources for radio that could save us a lot of money off our budget if we could fix that problem?
I'm hopeful that it could, but I was hopeful when I first started almost 7 years ago, that in 2 years, this department would be stabilized and, I'd have time to deal with a lot more
tools that it takes to complete the task.
Exactly. This will go.
That's a big budget hit that it would be nice to not have to.
This will go, this will go a long ways to giving me as the director time to forecast and plan for the future and take on, the extra projects such as finding sustainable revenue and making those recommendations, yes. And lots of other day-to-day things that need to get done.
That's the big one I'm looking for.
Yep. I hear you. It's next on my calendar after budget.
Okay, so what I'm looking at is in 2021, you had 2 comms officers positions that was open for a month and one for 6 months and one for 5.5 months. If those positions were full and you actually had those in there, how much would that have reduced the amount of overtime we just paid? Because I'm looking at what you just put here that we're already, 9 months into it, we're at 141,000. By giving you 2 more comms officers positions, boxes, in essence, doesn't mean they're going to get filled, doesn't mean they're going to get hired. But we then have the same issue that you're going to be paying overtime at the current rate we are. And, I look at overtime as time and a half plus the benefits. For me, it's, you're asking for 2 positions in essence on this one. And that adds up pretty darn quick. We already have the boxes there. We just don't have the people filled and trained.
They're revolving boxes.
Because it's a
is the
revolving.
problem.
Yeah, because of the turnover, right, and the training lag of 5 to 6 months for a entry-level person. Just getting them hired doesn't do anything for you. It's once somebody leaves, it's a 5 to 8 month process to get them on the floor and actually filling a shift. So adding any number of more boxes gives us the ability to have open positions and still be able to cover all the shifts that we need to cover without overtime, if that makes sense.
I don't think you're ever gonna fill the boxes.
Right. If we
Forever.
right, yeah, there will always be turnover.
Yeah.
So
So,
if we get to, now we have 10 comms officers, one of which is a lead, but so to staff 24/7, 365 day-night coverage with 2 people on duty, it takes a minimum of 8 people. If nobody ever takes a vacation, ever gets sick, ever wants a time leave or anything. So now we have 10. So anytime one person is down and we have to get our people leave, then 10 is not always having to work overtime. Anytime one or for sure 2 people are out, there's always overtime having to be done because you can't cover that. It's complicated by the fact that only certain people, right? If they work night shift tonight, they can't work a day shift tomorrow, right? And those kinds of things.
So for building the department, do we need to just assume a vacancy rate. Because we build all these schedules as if, because your current org chart, if every box was filled and everybody was always able to work and we never have any vacancies.
Never had any vacation.
And, well, no, there would be, the current 10 would allow for vacations and everything. So the current, if it was at 100% on a long-term basis, we would not have all this stress over overtime and everything, because the shifts, it's mathematically possible to cover all the shifts.
Correct.
But
Not 100% practical, but it's.
but that's the
mathematically
issue, is that what kind of factor do we need? Because that's really what we're doing, is that we're adding more boxes to have a certain, are we always gonna, and we're gonna, maybe short periods of time where, in a sense, we're almost overstaffed if we did that, where we would have more, if everybody was, if all the boxes are full and everybody's there, we almost have too many people. But history has shown, I mean, there's other stuff to do, and I'm
I was
not
gonna
gonna say, I know, but there's not a department in this building that would not love
Right.
to have extra people to do other stuff.
It doesn't come down to just staffing and 911 call taking and emergency dispatching function. And like you said, there's so much more to keep all of the dispatch systems operational so that they can actually do that. Yes. And right now, and what I've struggled with for the last 6.5 years is to have that time, not only to supervise those employees effectively, but to do all that backroom work, back end work on the management side with just 10 comms officers. One of them trying to be a lead, but still in the schedule,
right?
By necessity.
One of the things we talked about in the panel is on this kind of shift, probably applies to the sheriff's department as well. Anytime you're 24/7, is either you're slightly overstaffed or you're slightly understaffed, but you're rarely perfectly staffed.
Right.
Because if you're a little overstaffed, then it's because nobody's sick, nobody's had an emergency,
right?
Something come up and the schedule works. Until we can solve filling all the boxes, it's hard to know where that balance
I mean,
is.
I'm always trying to find that sweet spot.
So the other problem we talked about, the big problem, and does play a factor in this, because we never get the boxes filled to see if we're understaffed or overstaffed.
Right.
So I hear where you're coming from, and that chief of operations, that position is currently vacant, that would be doing a lot of that work.
Just filled it.
Just filled it, congratulations.
Promoted Filiberto onto their else
Okay,
last, I don't know, Thursday, Wednesday. Yes,
so, but that's gonna be a position, hopefully it doesn't take much training now, but that should be able to handle a lot of that, paperwork, keeping the things up behind the scenes and all that. I mean,
that's what we've been struggling to do for the last 7 years, yes.
right, so I look at it and just like Dave was talking about, to me, this is, how many boxes do we need so that we're always in recruitment, knowing we have turnover at this rate that we can now see, and we can now plan for that, because that's a long enough time frame. We should be able to plan for it. And there's always somebody, going through training, because it's going to be gone. The question is what's that proper number, so that you're going to have a little bit of overtime. You're not going to have, like, we're at too much overtime. I mean, we're in essence 3 people of overtime right now, because it'd be like hiring 3 people and you have 2 people running overtime all the time.
And not just from, I mean, that's one of the focuses is the monetary issue, but we're going to continue to have turnover because of burnout, because every overtime out, every dollar equates to hours. And then there's those people that are putting in that time. That's why they go find regular jobs.
Which goes back to that question of how much overtime do these communication officers want? Because time and a half is good money.
There's always got to be a little bit there on the table for those.
And some people want to do more, some people want to pick up slots, some people, you hope you have those there and that's available. So the question is based on what you see in your department of how much overtime people want. And then you have to, as manager, say, this is how much you want based on what your needs are, but this is how much, this is when you're going to burn out.
I made those decisions just yesterday. We put it out for volunteer coverage to begin with. before we just set a schedule and force somebody to work, right? We have a spreadsheet that we put out on Google Sheet. And they can volunteer for all the open shifts as soon as we have someone leave, and then we know what those vacancies are. Yes, and our people are dedicated. One in particular signed up, I think it was for the whole month of October, to only have 1 day off at a time in between stretches of 3, 4s, and 5s on. And I had to say, no, I can't approve that.
We have,
For reasons not stated here, I had to review every email over a period of a year between employees and management requesting time off. And very little of any of it was anybody wanting overtime. It generally, maybe predominantly was somebody saying, I know you have to go. Let me cover that shift for you. I know you've been planning to do this, let me cover it. Or I know your child is sick, let me work half a shift for you so you can get away.
their family in there. So they're
And
covered.
in fact, that his largest burnout besides failure to make probation is people taking 9 to 5 jobs, 8 to 5 jobs, is to get out of that 12-hour shift. So I think in this case, at least in everything I've read over the last year, it's more to help each other out and less about, hey, I could use a little extra overtime, which would be legitimate either way, if it's available and
There's always going to be a little bit there for those people.
but in this case, I think they're just trying to keep each other from burning out.
They're volunteering to cover for each other.
I'm gonna move us along. I don't want to shorten you, but
As long as I've answered all your questions, I mean, that's what I'm here
anything
for.
else right now as far as questions at this time?
No, I wanted to say thank you. You got me all of the information that I was asking that makes it a lot more logical for me to see what we're doing.
Welcome. I'm sorry I didn't get to you sooner.
It's all right. It's been one of them days.
Yeah, lots going on.
Weeks, whatever, years.
Thank you. Is that all?
That's it. Thank you, sir.
Thank you, gentlemen.
Madam Clerk. She's patiently waiting.
Sorry.
You're good.
We were for a time the highest rated show in Klickitat County, so.
We were today, we were up to 60 or 70 or something.
Didn't quite hit that,
Right?
but yeah, the people in the room, we were over 7.
Yeah, it was a wreck.
So I'm just back because you had requested what it would look like for the maintenance. If I would be able to offset the $7,500. So maybe just refresh the 35,000 is what is needed to implement the e-filing software. And then the maintenance for that each year is $7,500. So I went back and I talked to the ImageSoft gentleman who's my contact, and he's been doing this across the United States. So he has a formula that he uses. And so of the cases that are eligible for filing, he projects that 50% of those cases would have people using the e-filing system.
If they could.
So based on my 2019 filings, the figure would be $5,800 at the 50% rate.
For that 1 year.
Based on the filings for 2019, which was a normal year,
Right.
not on 2020 or
2021.
So theoretically,
Dollars.
that of revenue that we would take in. Yes,
and 7,500 in annual maintenance expenses.
yes, that would help offset that.
Right.
What do we use that 5,800 for now that you currently have? Because that,
I don't have e-filing, so I'm not, it's not revenue that I'm,
Would have had.
So how much would I'm assuming e-filing will have less of a staff work as far, will that free some, I mean, if people are e-filing versus filing in person, is
Mhm.
that?
so it'd be
less
less,
work?
you wouldn't be opening the mail, you'd be opening the system to say, okay, yes, this meets the qualifications. And then you, and I don't know all the details, it's been a while since.
I mean, is there gonna be a help as far as efficiency with your staff from using e-file versus not?
You know,
using
I'm not even gonna project that because it never.
I'm not saying I want dollars back.
Yeah.
I'm just saying it is,
I want.
like, if I
want-
was, like, we get literally hundreds of emails a day.
Mhm.
If I was opening and reading hundreds of physical letters a
And they happen
day
to file them.
and having to file them, there would be.
Right. Okay,
Although
but,
when people used to have to write letters, I wouldn't have got 100 of them.
yeah,
So
yeah.
that's what I'm just looking
mhm.
for. Do you think, I mean, is there some
Well, and
efficiencies that you could use staff in other ways?
here's the caveat, because we're not a paperless court, we still have to print those documents and put them into files. And until we become a paperless court, I'm not sure that we are going to see a reduction in time spent.
Okay. So why do we do it?
Because it's going to be, it's more efficient in the process of paperwork. And because it prevents the foot traffic into the courthouse. And because we are kind of a long county and people are.
So better service.
It
to
would be a
to our
service, yeah,
constituency. Okay.
yeah, it would
Okay,
be a
that's
service
That's a
that
very legitimate,
Is this gonna be a mandatory thing eventually?
they have been talking about it in legislature, but I don't know if it will become mandatory. It possibly at the Superior Court level. There's a lot of things that are playing into that because of the Odyssey system that is going to be implemented at the CLJ courts.
When you came up with the 5,800 number, did you set your own rates for what it would cost them to file?
It's
Or is it set by statute?
no, there's no statute.
Okay, so you just kind of figured a number and then did the math on how many people and came up with 5,800. If you had raised the number by $5, it would have been 6,300.
So there are four of us, well, if I am given the go-ahead, there will be four counties that are implemented at the same time, Benton, Chelan, and Douglas. And so we want to keep everything, similar
So you
between
have
the
the same
counties,
rate
and
across the
$5 a filing seems to be what the going rate is. So that was what we were thinking.
So that was kind of my question. So
Are any of those paperless courts though?
Pardon?
Are any of those four gonna be paperless courts?
The other three.
The other.
I think that Benton is trying to work that way, but she's got some issues that she's working out. And Chelan, I'm not sure.
You know how many other counties in the state are paperless courts? Are there very many?
No.
I guess where I'm coming in is I'm across the board uniform that I believe the user needs to pay the fees. And so if this 5,800 is based off $5 per user and you made it $6 per user fee, it gets closer to your
Well,
actual number.
And I agree.
If you made it 7, then I don't have to subsidize. I don't like subsidizing whether it's building permits, planning permits, anything else.
Well,
One of the
everybody
things-
knows the clerk is just
Right.
waste money right now.
Right, I've
No,
always
I don't
done
have
that,
any
yeah.
true issues
One
with
of
it.
one of the things that the clerks have said, if you have an efficient e-filing system, people are happy to use it. What is currently available out there is not very efficient and people hate using it. And so people's numbers, when they started using e-filing, climbed. So I am gonna say that by the end of 2, maybe 3 years, I may be meeting that maintenance fee or, going beyond that. So until we implement it, you don't know. I mean, we get a lot of attorneys filing paperwork up and down the gorge that would prefer not to have to snail mail something or drive it up here because you're not meeting the court deadline. So I think it will be used more than the 50%. Would you agree with me, Mr. Cannell?
And your $5,800 number is based off 50%.
50% of the cases that you could use the e-filing in.
Of the cases that could do it, you're saying you did this number based off 50% of those would do it.
Yeah, it's based on what his knowledge when he implements courts and how it looks.
So I guess I go back to the thought of, I know what the new recording fees cost, which is
Well,
practically
they're
filing as
lots.
well.
Yeah.
And it's a lot of money.
Mhm.
And we're dealing with the lawyers that
Mhm.
they drive up here, that's probably $500 of cost. I think $5 for a recording fee is very, very low when it comes to the ease of use, what you're getting out of it. You guys still have to print it off, so it's not really saving us money.
No, I think it's, I looked at the cost to print, and it's less than a penny to print a page. And so one of the things that this system will do is it will send it straight to our on-base, so it will cut down on our scanning that we're doing manually.
So there is saving.
There is saving
efficiency
there, right? But I think that's going to be taken up by the cost, by the
So-
copying.
So
So I think it might be offset.
if I was looking at this from a business perspective,
Mhm.
just, on the private side, I would say if the cost is $35,000 to do it at $7,500 a year,
Mhm.
I'd want that 35,000 paid off in 3 years. And based on your 50%, hopefully it's gonna be higher, but I'd set it low at 50%. I think it'd be higher than that. Make that pencil out, and then that was what the fee would be. And then if you come in front and say, I need the upfront cash today to pay it for 35,000. It's gonna pay for itself in 3 years, the 35,000. It's going to increase our efficiency inside, that we're not sitting there manually scanning things. We're gonna have the printing fee, but that's a cost to it. And I know what it costs to get something printed out in the auditor's office. It's not cheap. Look at that, try to manage that together, and then it would be a no-brainer for me.
Well, and that was one of the reasons why I asked for, because I'm not sure the 35,000 that I could meet or exceed that initial cost. And that's why I asked for the money to be funded through the American Relief one-time funding request. And that's what I'm still asking for, is that money be funded through that,
So
not through my budget.
Mr. Commissioner, are you saying the thought in your head is instead of $5 fee, it's 15? That way in time it pays off the initial 30. Is that what you're kind of saying?
Can do that pretty quick.
I'm just throwing a number out. I know you didn't those real numbers. You're trying to get it to completely self-fund itself over the period
Of 3 years,
Of 3
just like
years.
anything else. And
Yeah, but it's really difficult when you're dealing with software to make those type of things happen. And
Right, I think he's talking, you'd get an initial, are you talking funding the project initially, but being funded back over the course of 3 years?
well, I'm just thinking that, the cost associated with managing it, because in the end, we want to go to, an e-court system. Sooner or later, we want to be all electronic, right?
yeah, I'm sure that that's
And it's coming.
on the
It's just a
horizon.
matter of time.
Mhm.
And there's gonna be a cost associated with that,
Of
right?
course.
And we're gonna be asked to pay for that cost to move into that whole e-commerce. And so I'm looking at this as, this would be step one of getting there. And how do you get it paid for over the course of time? One thing you would do, like what we're doing with the bridge and everything else, is you'd say, your fee, it would regularly be $5 for filing. We're gonna make it $15. It's convenient. You're saving way more than $15. It's good for them. We're starting to build up a kitty so that we can go to a full online or full e-filing. And then when we're there, then we're actually truly starting to save efficiencies in terms of personnel and management. And so at 35,000, yeah, I think about $15 over the course of 3 years would get you a lot closer.
But not actually starting the
$15
project.
for each document
Each document
file.
And you're saying not even starting the program for 3 years because you're trying to save up.
No,
You're willing to fund it and then get refunded over the course of 3 years.
in essence, it's all coming from
Right.
the same money.
Right.
I was just saying.
I was just trying to understand your theory there, and it sounds like I'm on board with understanding it anyway. I guess I would question the two of them. Is $15 gonna price yourself out of people using it?
I think so,
I would think
because,
so too.
yeah, $5 is what the standard is throughout the state.
If they said 5, 6, 7, I think they'd go for it. But I think if you went higher than that, they're just not gonna use it, or you wouldn't even get 50% compliance, you'd get 20%. Because they can type it out, throw it in a manila envelope and pay $3 in postage and not have to worry about it.
Yeah, but you're also looking at the time. You know, you can get something in the same day versus 3 days ahead of time. You're looking at, now they don't have to print it out, or they're
I
looking
just
at.
don't think they would pay that kind of money. I said, if you were down at a, you know, $5, $6, $7, $8 or something, I think you could do it, but I think you're gonna scare people away more than that.
So, is there any chance that that we could make a decision on of it coming out of the American Relief Plan Act money?
There's, oh, yes, of course, there's a chance. I think that's not what you're asking. You want us to
hurry the hell up.
Yeah.
Yeah.
Yeah, we have not actually obligated any of those dollars.
I know. Mhm.
So I don't think we're gonna obligate them today, but I think.
My way of thinking on it and what would make me feel comfortable is if the $5, like I said, at least if there was a way to reevaluate the $5 to make sure it covers the yearly maintenance. Because I don't want I don't want a year over year.
Yeah, nor do I.
So
I don't want to look
like
at
I
you
said, I
guys.
would prefer to make it $6 or $7 so we know it's gonna cover.
So-
And or the ability to reevaluate on a yearly basis.
Well, and I
To change
think,
that.
that that's always a possibility. I mean, you reach out to the Bar Association and send them, you know, the information and that, you know, we are implementing this process and it's at a cost to the county and we're going to reevaluate to make sure that we're meeting the yearly maintenance. And those fees may increase to offset those costs.
Right, I mean, I would say for me, I'm open to having a discussion about using the rescue dollars as far as to fund this as a capital, you know, it's a piece of software, hardware
That's
stuff.
what I want it for.
Which it's appropriate, we can talk about that. As far as the maintenance fee and the fee to file, because we're guessing at this point.
Yeah.
And so I'm actually okay with having the potential of a loss leader just to get people hooked on it.
Right.
It's way easier if I'm used to paying $5 and I really like the service. And then next year we're able to come, you know, once we actually
I
have
just wanna
some
make sure there's
data,
a possibility to reevaluate.
that we could go back and say, you know, we looked at this and really for us to be able to continue this, you know, we front loaded this and we're doing it, but to make it pay,
Yeah.
it's gonna have to be $6 or
Right.
whatever. It's way easier for me to get people, it's kind of like the auctioning, you know, auctioneering where, you know, if you set your thing too high, nobody will bid and then
Right.
they work up and they end up spending twice as much higher
Yeah.
than nobody would touch it. Cause they
Right.
gotta kind of.
Yeah, you got it. Yeah, exactly.
And just see, and then I guess the question would be, what happens other than we've invested $35,000? If 3 years from now, nobody likes it, they don't use it. they
Well,
hate
it's a
it.
nationwide system and I don't think that that's what people are gonna find. I've watched the little tutorial that he did. And the way it works is when you sign up to use the system, you have to do one of their webinars so you know how to use the system.
Okay.
So it comes with training for the users and that's on the software side. They take care of that for you.
See, that was my next question. Is it ongoing training? So if you have turnover in your department,
No, this is for the users that are using
them.
the attorneys.
right? My question
Uh-huh.
is for usability in your department, is it just super easy? It's just open a document, there it is. You don't have.
It'll
to
be part of
play
our,
with any buttons and you don't have to train anybody and.
it'll be part of our daily work. And so anytime you lose somebody, you got to train them on your daily work. So
it's not
it's
like-
just a
It's
process.
not, right, but it's not like our department's updating our county website that they do every 3 months, so they really don't know how to do it.
No.
You're gonna be dealing with this, it's gonna be easy to train the next person. It's not
Yeah.
gonna be a training.
And the other thing that I want to mention too is that it involves very little of the IT time to facilitate the use of the software.
Right, isn't that part of the, you know, the 4 counties going together is that there'll be, as far as the support.
Well, it's just that
this is not a cheap system. And so he gave us prices based on a group of counties.
Oh, doing it.
But
Okay.
yeah, going on at the same time. And so,
But that maintenance cost covered, so they're going to.
yeah, that's gonna
Take care of
cover,
that. That should cover the IT as far as the.
right.
Keeping the system up and
Mhm.
updated.
And training the
running.
users that are trying to utilize the system to get their documents filed. with
Are the
us.
documents held on our servers or are they held on this company's servers?
And I'd have to get back to you on that. I'm thinking that it's held on the other servers until we say, yes, we accept that document, then, and then it goes to our document management system called OnBase. And then it is stored permanently on our server.
So we have an on-base server in our IT.
Right, the
side.
clerk's office documents are, we have to keep them forever, so, documents have to be stored regardless. We can't get rid of anything.
Right.
And I guess
It's a really simple retention schedule.
Yeah, right?
I'm on board for the most part, but what I need is a statement, a letter, an email from Jeff at IT to tell me adding this service will not increase our cybersecurity risk by plugging new software into our system.
Okay,
If
Yeah, I can
he's
get that
game
done.
with that, I'm a hell of a lot more comfortable.
okay, all right.
Because I think we have that kind of issue in the past that can't continue.
And I'll say I'm in favor of moving closer and closer to a fully e-file system, paperless court, all of that. I like the first step. And this is, up on my list for the CARES dollars is at about the same level as the visual audio for the sheriff's department. It's just where we're gonna have to go.
Yeah. Do you have a deadline for when you have to have a final answer for this?
Well, the other
Sure you
three,
want to say, but-
counties have already said yes, and I believe two of them
ASAP is
are
what you said.
using CARES money. And,
That makes it, I don't, Jen's not in here. so-
yeah,
So that it is
yeah.
it's, at least their folks have said it.
The only thing holding me back is the letter or statement from that.
Oh,
Yeah.
whoops, that's-
Yeah, and I don't think it will be a problem.
I don't think it will either. I just.
I mean, two other counties have felt like this is a qualifying expense. Do you want to look at that? I don't want to put you on the spot.
So the
We
other,
don't always do things the way other counties do.
yeah, so the other county, in Benton County, it was.
Well, they're
said-
just crazy in Benton County. so
Yeah.
they'll
Right,
do
they only
that.
got 40 million that they weren't sure how they're gonna spend it all.
Yeah, They were already broke, so.
Yeah, so it was told to me that any income that came in would have to go back into the grant. And when I mentioned that to Rob, he said that the first batch of money that came in was to offset the loss of revenues. And
Right.
so that didn't have the same attachment to it. Is that correct? So,
She will look into it.
okay. I just want to make sure that money doesn't have to be put back into the grant pot money.
Oh, so you don't want to give back. huh?
Well,
No,
I-
it's
I
not
just-
that.
I
It's
just
just if
remember
we're-
that
if- Yeah, you're correct. Now, as far as the bulk, all but 56,000 of the first tranche, which is a word I've never used before until this year.
Is that an official word?
I think it is. It's an official word now.
25.
Of money, so 2 million of it plus does qualify as lost revenue, which means it's
it just,
just general purpose dollars for the
Right.
most part, with
Right.
some strings, but very few strings. And so that is true, but that's a
And
discussion
so-
the board's gonna have to have on.
and
how
so, just let me give you this thought. So the 35,000 and plus the yearly maintenance fee would be due in the beginning. And so then, I mean, that's what I would be asking for from the CARES money. So the rest of it would have to be budgeted money. Unless we can figure out a way to put the other 7,500 into the 2023 budget.
Okay, let us work on that.
Okay,
We'll
all
get an
right.
answer.
Well,
And-
it shouldn't need to go in the 2023 budget, because if you implement this for 2022 and you're collecting user fees, hopefully the user fees pay for the maintenance. on the
Right.
It'll be a revenue line associated,
Yeah,
Right.
it would be a revenue line to offset the expenditure line.
or at least close.
Yeah.
The other option is to let the ImageSoft collect the revenues and then they bill us for the difference. That, so the $7,500, if we only made 5,800, then they would bill us for the difference. But then if we went over that amount, then I think over the 7,500, they may send it back to us. I mean, so either way, it's like.
Yeah, that's just something to check with finance and auditor on how
Yeah.
to prefer that and legal.
Yeah, it's, yeah, so you
Okay.
have.
You got a
Anyway,
little bit of homework to do, and then
All right.
you'll
I'm gonna
get
move
so
us
you need a
along.
letter.
Yeah.
Okay.
and figure out how we're doing whether they're keeping the money and billing us or whether we're getting it and paying them.
Well, it's our choice. It's our choice.
I just want to make sure the auditor and our finance person are okay with our choice.
Okay,
Just like I want to make sure the IT person is okay with our choice.
okay.
Okay,
All right, thank you.
thanks for me. Okay,
Mr. Chairman.
Yes.
I would make a motion to approve the consent agenda with all 12 items.
I will say the motion.
we have a motion and a second on consent. All those in favor say aye.
Aye.
Aye, motion passed. Let's pay the bills.
We'll start there. Mr. Chairman, I make a motion we pay accounts payable warrants in the amount of $341,652.09 and the payroll benefit warrants in the amount of $0 for the date ending September 20th, 2021.
We'll second the motion.
Thank you. Have a motion and a second on the bills. All those in favor say aye.
Aye.
Aye, motion passed. Good progress, team.
Mr. Chairman, I make a motion that we pay estimate number 3 to Gray Works LLC in the amount of $120,636.00, excluding $6,431.80 in retainage for a total pay amount of $122,204.20 for the Old Mountain Road project.
I'll second the motion.
On pay estimate number 3 to Grade Works. All those in favor. All those in favor say aye.
Aye.
Aye, motion passed. Good, I'm glad you got that.
Mr. Chairman, I make a motion that we approve change order in the amount of ECO number 1 with via deduction. There's too many commas and periods in here. $1,513. ECO number 2 conference room display will be additional $24,812. ECO number 3 revised display and projector will be additional $11,975. The original contract amount was $80,500. With the revisions, the new contract amount will be $115,774. This is not including tax.
I'll second that motion as well.
Okay, I have a motion and a second that I am not going to try to.
We badly worded.
No, it's, no. This is revising the contract on that.
Right.
Okay, all those in favor say aye.
Aye.
Aye, motion passed.
There was a word message or something from that first sentence. I was trying to figure out.
They're all in here. But we don't have one to Kirby Nickelhouse today.
That's all I did.
Okay. Apparently I imagine that in Gordy's.
That wasn't on his list.
Okay, it wasn't on his list.
He
Okay,
just had that one pay estimate.
yeah, no, it's okay. I was just double checking. It seems like we've had one nearly every week. We're at that stage in the game. Okay,
I got this major board pending.
all right. Go ahead.
The Washington Rural Insurance Group that we are a member of, if we are so choosing to consider changing that, we have to turn in a termination notice. By their contract, you have to turn it in by like whatever, 180 days prior to the end of the year, which makes it October 15th. So if we're going to do that, we need to be on the ball.
Okay. I would suggest
she knows more details. So we have time, we can cancel it and keep the current insurance at any time next year. Or we have to tell the new insurance carrier that we're signing on by like April.
But what I would suggest, I mean, that's a huge decision to make one way or the, not, I mean, the easiest decision is do nothing and we're fine. But I would like to, I think we should take some time and actually proactively make that decision to stay put where we are, if that's what we're gonna do, not just do it because we don't have time to review and I think about it and do some
I had a
analysis.
phone call with them, and that's kind of what I told them. It was pretty much, we're kind of busy right now.
We're all kind of
but
busy right now.
What we're thinking is we'll put in the termination notice or whatever you want to call it. And then after budget season, we'll have plenty of time to have conferences, workshops, bring them back in, bring the new people back in, actually sit there over the winter season, figure out what we want to do, and we have until April, whatever, 15th to figure it out. And they're fine with that. That's our current carrier. As long as they have an opportunity to try to woo us, they're fine. Fix some of the things we would like to.
Okay, well, I would suggest that we hold this over to next week to have some.
That's fine. I'm just
No,
reminding of the date.
I agree with you. I agree. This is
Gotta-
huge.
Gotta hold it over.
Right. Anything else?
Because when we put in that statement or whatever, then somebody else is gonna have to start making plans too. And so while we're trying to hold ourselves open, it's impacting others, and I need to make that decision from a place of
Information.
I'm not here to get a vote. I'm just here to keep you all aware of the date.
Okay. Anything else? Okay, I'm gonna move us on to prosecuting attorney, I believe is next.
Did we want to talk about that, Mochi?
No,
I mean, it's,
I think we should address it. I think it's only fair to our employees that we address
Okay,
it.
go ahead.
Bring it up.
You, lead us off.
so I received an email from a constituent that listened in on the radio interview where there was some discussion had that I would say is highly inappropriate, that is beyond disrespectful on, I think, 1400. And from what I understand, I don't believe we can get a copy of it, so I can't exactly find out what was said, but I put it through enough people that I think I've got a pretty good understanding of it, and that the radio DJ or whatever you want to call him was in essence egging the person on. And that upsets me to a whole nother level. And I think it would behoove us to, as a board, have a conversation either with that DJ, with the company, to be very clear that we will not put up with that. And if that kind of language continues, we will not be doing interviews with them.
Or any business with
them, flat out. That's just so inappropriate and so beyond what common courtesy and decorum and what needs to happen. I'm just not okay.
And for the sake of transparency and full disclosure to the people listening on the radio, I will not name names. But the comments were essentially about our planning director and her heritage. Calling her out for being Chinese and the fact that we hire Chinese people, which she is not, as far as I know. And it's like, quote, having a fox in the hen house or something to that effect. And we should be hiring Americans. We shouldn't be hiring Americans that barely understand English and or can speak English. And the show agreed and said, hire American, buy American. They were trying to relate it to the Chinese solar panels. And I find it very racist, very bigot, and I'm pretty pissed off about it. And on a future discussion, I would like to hold a conversation after discussing with the prosecutor on actions we can take against that individual.
Yeah, I, go ahead, Mr. Ross.
I actually heard the comment.
That's why I was gonna ask, I didn't want to put you on the spot, but I did not hear
I caught the
directly,
tail.
but I heard it was.
I got the tail end of the Wednesday. I will say, I don't believe the DJ was actively encouraging it, but he took no steps to discourage or chastise or in any way he didn't respond in any fashion, which is, his right, but so, the comment was something to the effect of Klickitat County having a land use planner that is an Oriental that can barely speak English, and made the insinuation that it must be a plant from the Chinese government to sell solar panels in Klickitat County. Again, there was no resistance from the host. There immediately thereafter was another person that called in and objected, saying that planner was a friend of hers, and that she objected to the characterization that she was a plant or a stooge to sell solar panels. And I was kind of shocked. I was shocked, but that if you spend much time listening to the college, you're going to hear a lot of viewpoints you normally don't hear. And so that was definitely one of them. I was disappointed. Well, I've been disappointed a lot lately, but disappointed that there wasn't any pushback at all, that there seemed to be accepted. But at the same time, there was an immediate caller that objected to that. And I think the characterization that he was encouraging it, I personally believe is not accurate. But
Yeah, I did have a discussion with the planning director after, just to really offer my sympathies as far as.
I did also.
I will say, based on what I heard from credible sources, that actually did hear it, that's fairly accurate how it's been portrayed, and that is, frankly, that's offensive. That, and I apologize to her on, I'm from this county. I was born in this county, and that's not who we are. And that, we are in 2021 and we're having to have this discussion about, what is not, it's clearly racist and bigotry, and that the host of that radio show did not push back on that. I will say, and I was saving my comments for our radio interview on Thursday with that very same. And if I don't see some policing of, and I'm all about free speech, but come on, especially they're supposed to have a policy against personal attacks. I don't know how more personal of an attack you can get.
Well, she wasn't named, so I think that's what.
Yeah, how many planning directors do we have in Klickitat County of Asian descent?
Just I have to caution the board that contemplating any type of retaliatory.
No, I'm not. But the retaliation that I will take is I'm not going to participate, as far as I'm not going to do interviews.
Well, that's
honor. That is totally within my purview. And I'm not going to, if that's the kind of show that they're running, then I have no interest in participating.
Our planning director, no one's perfect. I have found her a very intelligent woman that is very dedicated to her profession. She and I have not always seen eye to eye. I don't think that's that's not a secret. But the characterization that she can't speak English, she has an accent. She has a thick accent. So did Kissinger and Schwarzenegger. I'm not saying it's quite the same level, but there's plenty of intelligent, articulate people that have done a lot for American society and culture that have a thick accent. So I was kind of taken aback a little bit. And that's not an isolated commentary. There was, not quite as extreme, but there was similar comments on another section I heard on Friday. So this is not. And when you say it's not who we are, this is
apparently that is who we are. It's not who I am, and it's not who I believe us to be.
We're 3,500 miles from the Mason-Dixon line, and people make a point of flying Confederate flags on some properties. So we do have a segment of our population that's who they are.
Did you
hear or recognize the person that said the comment? Do you know who it was? I mean, I have somebody else that thinks they know, but it's.
Yeah.
Is that accurate?
I believe so.
Have you read the email? Is it accurate?
I haven't seen you.
Well, I'll talk later to you about it. Then. I don't want to name the person unless I'm sure.
No, I don't think that should be. But,
Okay. So I think more on the topic on Thursday. I've been, as far as at least, yeah. During our interview.
I think, I don't know that it's enough for this board to publicly say right here that we appreciate Moshi, support Moshi, and stand behind Moshi. But if anybody wanted to go more than that, I would be more than happy.
Yeah, I mean, I certainly do, and I have communicated that directly with the planning director as far as, you know, and it's, again, it's not, I have worked with her for, you know, since she's been the director, and obviously before, again, have not always 100% agreed with the approach necessarily, but she is a highly intelligent, highly articulate, and certainly has a work ethic that would put an Amish farm wife to shame as far as it is.
Right.
It is.
You have to force a woman to take a day off.
So people should not make generalities and make, you know, about people's background based on their looks or their accent, that there's always more to the story than people realize. And
well, I think
for
it's
the person, if the person's listening, shame on you. As far
well,
as-
I joined in that. All right.
I apologize to all the Amish housewives.
I do too. I do too.
I didn't catch
I don't want
that,
to
but-
trigger how much house, but even though I can assure you they won't be listening to the radio. But in any event,
There could be a rebel or two out there.
you know, it's just an important parcel of something that seems to be increasingly present in American and especially American political society. A kernel of fact being widely misinterpreted and misused to spread misinformation and spewing hate and lies. We have a significant portion of our society that is willing to believe outright lies. Which brings me to my presentation. I enjoyed my experience on the canvassing board with our recount that occurred on Friday from the hospital bond initiative that did, get a little over 59% of the vote, but fell 17 votes short of passage. They did ask for a recount. I was extremely concerned at first. The sorting process took about 5.5 hours. But once the voting got started, it was about an hour and a half. I think the Brenda Sorensen, the auditor, and her staff are being highly complimented, as well as the volunteers, the casual employees that came in to do the actual counting. I think it was a wonderful demonstration of the integrity of the electoral process, not only in this county, but nationwide. Every single election in this country is run by similar groups of people on a county level, and not a single discrepancy was found after about 8 hours total. Not a single discrepancy was found.
So not one changed vote.
Not one changed votes. The machines got it 100% right. Our system was 100% accurate. And I was very curious as to I think there was conversation with several people. It's like, well, this is a bit of a test. We'll see. Our local elections department passed with flying colors. It reaffirms my belief in the nonsense of the lies that are just spreading throughout our electorate that is doing grave and possible permanent damage to our democracy. Our system is one of the best in the country. We have free and fair elections in this county and this country, and I think the recount demonstrated that in abundant fashion. So I'm very proud, again, of the election department, of the work of the canvassing board and the recounters.
Yeah, I would echo all of that. It was, I gave my regards to Brenda and her staff and those volunteers who did the heavy lifting as far as we were observing, and we did help, but we were definitely in a support role and an observer role. And
Well, there's 6 people counting and 12 people watching to make sure they're not cheating.
Right.
I mean, it's really what it boiled down to.
it did, and it was really heartening to just have my faith reaffirmed, as I've said, about, our election system it has integrity. It has, and that bore it out that there was not a single discrepancy. The vote total, and believe me, there was checks and checks and checks and checks. And, looking over 5,000 ballots is not an easy task to do. And with all of those the different precincts and the sub precincts, and to get those in every single metric, it matched perfectly to what the machine.
No, I think it was a great moment for Klickitat County. And so we do have a new victim witness coordinator that started last week that we hired. Part of the woes I think you've been hearing about from, we did hire a former dispatcher that came over to us. It's been a very good experience for us. Sorry, Jeff.
You're the problem.
There's no turnover in dispatch.
Well, I think I'm accounting for 2 of the 17 so far. All right. And then also the thing that has really become a passion project for me is to kind of reinvigorating, that's a tough word, re-energizing the multiple disciplinary team focused on child abuse investigation, child abuse and neglect investigations. We've had MDT, every county is supposed to have one by statute. We've had ours has been dormant for about 15 years. Part of the PA is tasked with revamping the protocols, a little overdue, but we're working diligently on that. We've gotten great assistance from the state Children's Advocacy Center. This has been a project going on for about a year and a half. We are doing monthly MDT meetings. We're finalizing some of the revisions to the protocols. We've gotten great strides in increasing access to the Children's Advocacy Center based on Hood River now called Safe Space. We have a contract through my office with them for about $12,000 a year, which allows for up to 6 children to be interviewed. The state has come in through grant funding to increase another $12,000, and then also programs for peaceful living obtained further grant funding to fulfill some coordination role, and another 6 slots. We're up to 18 slots. We're still short of ideally where we like to be able to have full access on behalf of Klickitat County to the Children's Advocacy Center. That would also include the full panoply of cases handled by our local what used to be CPS. It's a new acronym, but the Children's the Protective Services. They have a local supervisor who's been pretty involved with the process. So I personally, now her name is Gilkerson, who has been most appreciated, as well as Kristen Poole from Programs for Peaceful Living. There's been, especially early on, assistance from Leslie Naramore at Wagout, which has been helpful, as well as the getting some of the law enforcement agencies to stay on board. The idea is that you have law enforcement, prosecutors, victim advocates, mental health services, the advocacy center, the forensic interviews, all coordinating, understanding what each other are doing, working pursuant to establish protocols of information sharing, monthly staffings. So the idea is that to make sure that every child suspected of having been abused or neglected is provided every possible realm of services that can be provided. The impact on children when they're traumatized, either physically or sexually, is lifelong and has detrimental impacts on that individual, on their family, on the community at large. And the most resources we can devote to try to hopefully identify and stop the abuse and neglect, and then also hold those accountable that neglect, especially serious physical abuse and sexual assaults, hold those offenders accountable is utmost important. So I know you guys are getting a lot of requests, and I'll mention it probably again in the next month or two. The increasing that $12,000 allotment, I think, would be appreciated by community members, and it's a fantastic use. I think the Safe Space has really done a wonderful job. They also provide medical forensic examinations at one spot.
it's really important. Yes. Clarification, is the 12,000, is this program related to CASA, juvenile probation?
CASA.
Or do CASA, or do they handle it after this place handles it?
No, CASA is actually, Ashley Bryan contacted me a couple months ago. She heard the work that was being done, and she's now been invited is participating in the MDTs. It's really separate. CASA represents the children under 12. It's either under 12 or 12 and under, I forget. When the child's interest is an issue at a court proceeding.
Right.
So generally dependency cases, things like that. So they can be a very helpful and useful advocate on behalf of the child to inform the judge of different considerations and making the best decision for the welfare of the child.
Is the 12,000 going to that program or that program?
No, it goes to Safe Space, the Children's Advocacy Center. Yeah. Because initially the state.
That had the pinwheels earlier this year, if you guys don't remember.
Correct, absolutely. I'd be happy to bring them in for a virtual presentation or an in-person visitation. Maybe they can bring the, the camera and show you around.
Pick the perfect day to do such a presentation to me, sir.
Well, it was a coincidence, not trying to take advantage of it, but so it is important work because the MDT is taking up a bit of time, and it's really important. So the filings continue apace. We have not had a trial in the last month or two due to some needs for continuances, and we're getting a good amount of cases resolved. So that's very good news. So yeah, any questions for me?
Lord, I hope not.
Yes, Mark. I'm done.
Any? I don't, or if I did, I've forgotten them now. I'll ask you later.
That kind of day, sir.
Yeah.
No,
Nope.
thank you, sir.
Thank you, sir. That's it. Do you need it? Yes, sir.
Should I just ask follow-up questions?
He's asking a question. It's 5 o'clock.
Okay, go ahead.
Presentation, follow-up directions. Do you want anything more from me? You want me to come back? Wait for you to contact me? What do you need? Next steps?
I'm just waiting on them.
I'm gonna go over this some more, and if I do, I'll send you an email.
Okay.
Yeah, I would leave that. I think I have what I need. It's not the.
Want me to schedule time on your agenda anytime in the future to revisit it, or just wait?
I
wait with a cattle prod in hand.
No, and that's what I would say, let us work through our thing. If you don't hear anything from us within a reasonable length of time, then put yourself back on the sketch.
Kind of throw this item on a board pending on a day we have more time, then we can might be able to sit here and talk about it.
Thank you.
Okay. Do you need any executive for anything? No, he's reading the room. Yeah.
Not a lunch break.
Okay, then I don't have anything. I would entertain a motion.
Mr. Chairman, make a motion to adjourn the regular meeting until Thursday's budget workshop. September
23rd. Okay, I have a motion and a second to adjourn the regular meeting until 9 a.m. Thursday morning at September 23rd.
With a note, we'll be on the radio that morning.
And we will be on the radio. Yes.
Don't let them put you in a bad mood. My budget session's at 9 o'clock. So
Ooh, really? Oh, perfect time. It could go well, or it could be great.
I'll try to read them.
All those in favor say aye.
Aye.
Aye, motion
Yeah,
passes.